Ready to begin? I will count down from 5, then we will start. 5, 4, 3, 1. The Subcommittee on Health and Employment, Labor, Pensions, and the Subcommittee on Higher Education and Workforce Investment will come to order. Welcome again, everyone. I note that a quorum is present. The subcommittees are meeting today for a joint hearing on care for our communities, investing in the direct care workforce. This is an entirely remote hearing, and as such, the committee's hearing room is officially closed. All microphones will be kept muted as a general rule to avoid unnecessary background noise. Members and witnesses will be responsible for unmuting themselves when they are recognized to speak or when they wish to seek recognition. If a member or witness experiences technical difficulties during the hearing, please stay connected on the platform. Make sure you are muted and use your phone immediately to call the committee's IT director, whose number was provided in advance. Should the chair experience technical difficulty or need to step away, Chairwoman Wilson or another majority member is hereby authorized to assume the gavel in the chair's absence. In order to ensure the committee's 5-minute rule is adhered to, staff will be keeping track of time using the committee's remote timer, which appears in its own thumbnail picture. Members and witnesses are asked to wrap up promptly when their time is expired. Excuse me. Pursuant to Committee Rule 8C, opening statements are limited to the chairs and ranking members. This allows us to hear from our witnesses sooner and provides all members with adequate time to ask questions. I now recognize myself for the purpose of making an opening statement. Today we'll be hearing about the valuable work performed by America's direct care workforce and the urgent care and need to expand these services for aging Americans and Americans with disabilities. Direct care makes it possible for millions of Americans to live independently in their homes and their communities. The degree to which these vital services enhance the quality of life for aging and disabled Americans cannot be overstated. They enable individuals who need assistance with activities of daily living to live healthy and productive lives and remain active participants in their communities. We know that people want to stay at home and they want to stay in their communities as long as possible and as much as possible. Direct care workers are a crucial part to ending the unnecessary segregation and advancing the civil rights of individuals with disabilities, as outlined in the Supreme Court's 1990 Olmstead decision. Unfortunately, these services are often unaffordable and inaccessible for those who need them most. Private insurance and Medicare often provide only limited coverage for home and community-based services, forcing family members and friends to care for loved ones, or alternatively to pay out of pocket for those services until their resources are depleted enough for Medicaid to kick in. The demand for direct care is also rapidly outpacing the growth of the direct care workforce. And unfortunately, individuals who need home and community-based services often find it impossible to access the support they need. The direct care sector is expected to add more than 1.3 million jobs between 2018 and 2028. Yet the number of people who will need direct care continues to exceed the number of workers who can provide it. To address this shortage, we must understand the causes. Direct care workers, disproportionately women of color, are chronically undervalued and overworked. Medicaid is by far the largest funding source for direct care services, and Medicaid reimbursement rates have not allowed wages to increase as fast as those in these occupations. Today, roughly 1 in 6 in direct care workers lives in poverty. 1 in 6 of these workers lives in poverty. The turnover rate for direct care workforce in 2018 was 82%. And that was before the pandemic, which forced more than 200,000 direct care workers to leave their jobs. Today, we will discuss the need to ensure access to direct care services for those who need them and also support the workforce that delivers these services. The American Jobs Plan calls for robust investments to expand access to home and community-based services for Medicaid and to strengthen the workforce through higher wages, better benefits, and sector-based job training and supports. The Direct Creation, Advancement, and Retention of Employment Opportunity Act, or Direct Care Opportunity Act, also expands workers' earning potential and provides the financial assistance for transportation, childcare, and housing that workers need to stay in their jobs. Our society and our economy depend on direct care workers. They deserve better, as do their clients. We are committed to that goal. I now recognize the distinguished ranking member of the Subcommittee on Health. I now recognize the distinguished ranking member of the Subcommittee on Health, Employment, Labor, and Pensions for the purpose of making an opening statement. Mr. Allen, good morning. I think you might be muted, Mr. Allen.
All right, there we go.
There you are.
You got me?
We got you.
Hey, thanks, Mr. Chairman. And I was thought I was right on schedule. I couldn't get in the hearing room, so I finally got in here. But we're here, and I want to thank my colleague, Dr. Murphy, for joining us in his role on his subcommittee. I do find it ridiculous that even unelected bureaucrats are back to working in person before Democrats in Congress. The Workforce Investment and Opportunity Act, WIOA, provides an important source of funding for state and local workforce development systems that are tasked with addressing the needs of the community. The federal government does not have the knowledge or foresight required to dictate what states need. I believe we should err on the side of flexibility when designing and funding workforce development systems with taxpayer dollars. Direct care workers are an important part of the healthcare workforce and care for our most vulnerable patients. Their work is often difficult and unrecognized, but our healthcare workers are valuable and should be recognized for the sacrifices they have made, especially during the COVID-19 pandemic. We know there is an incredible amount of turnover in the labor market for direct care workers. We also know that most direct care workers did not pursue additional education after high school. As ranking member of the Subcommittee on Health, Employment, Labor, and Pensions, I hope today's hearing can shed light on how Congress can help all workers, including direct care workers, gain the skills they need to improve their upward mobility and sustain a fulfilling career. New technologies and practices developed in the private marketplace are revolutionizing the healthcare field. We must ensure workers are not left behind. The federal government has an interest in sustaining a workforce pipeline that recruits, retains, and assists individuals interested in finding the right career for them, including careers within the healthcare workforce. But Congress cannot fall into the trap of having hundreds of different programs, each devoted to one particular occupation. This is why I advocate for apprentice-style programs. Combining structured on-the-job learning and classroom-based instruction gives individuals a low-risk option to determine if a job is a good fit for them. In the same way, earn and learn programs are another way to help folks find that rewarding career. I look forward to working with my colleagues on both sides of the aisle to find innovative solutions to address the healthcare workforce challenges facing our nation. And I look forward to hearing the witnesses' testimony today. And with that, Mr. Chairman, I thank you and I yield back.
Thank you, Mr. Allen. I now want to recognize the distinguished chairwoman of the Subcommittee on Higher Education and Workforce Investment for the purpose of making an opening statement. Chairwoman Wilson.
Thank you, Chair DeSaulnier. I want to add my thanks for our distinguished witnesses' time today. In addition to low pay and difficult working conditions, the direct care sector lacks the training and career pathways that workers need to join and remain in this profession. Direct care is hard work. It is physically and emotionally demanding and also requires knowledge of complex health conditions such as Alzheimer's disease and dementia. Yet, Training for entry-level direct care workers varies widely and is not reimbursed by Medicaid or Medicare, leaving many workers unprepared to safely provide quality long-term care. In addition, these workers often do not have the required education qualifications to enroll in training programs and would offer professional growth. Without these pathways, direct care workers often become stagnant without the opportunity to advance into higher paying positions. In most professions, workers can increase their pay as they increase their skills and experience. Direct care workers should have that same opportunity. The American Jobs Plan dedicates resources to improve the lives of direct care workers. This mirrors the Direct Care Opportunity Act, which invests in recruiting, retaining, and advancing the direct care workforce pipeline. Those resources will allow states and local organizations to pursue the best solutions in their regions, from training programs and registered apprenticeships to mentorship opportunities to make direct care a more sustainable career. Supporting a well-paid and well-trained direct care workforce is vital. It's vital for aging Americans. It's vital for individuals with disabilities. In 2015, in my home state of Florida, 6,000 people died while waiting for home care services, according to the Department of Elder Affairs. Sadly, this underscores the desperate need for increased investment in the direct care sector. Strengthening this workforce pipeline is not only the right thing to do to support our nation's direct care workers, it is also the smart thing to do. With the right investments, the direct care field will be able to offer millions of good paying jobs with low barriers to entry and ample opportunities for career growth. As we recover from the pandemic, which erased millions of jobs, enhancing the direct care workforce would help people get back to work immediately and secure quality long-term care for those who need it most. I look forward to our discussions today, and I now yield to the ranking member, Mr. Murphy, Dr. Murphy, for his opening statement.
Thank you, Chairwoman Wilson, for yielding. I'd like to thank the witnesses for joining us today. Direct care workers are an essential part of the healthcare sector. I personally have worked with these individuals for over 30 years and understand the dedication that they have to their craft. These individuals act as primary care providers of care, supervision, and emotional support for older Americans, people with disabilities, and individuals with chronic needs. As a physician, I understand the value that they bring to our healthcare system and the sacrifices that they make to serve our patients. Data from the Bureau of Labor Statistics estimate that there are over 3 million direct care workers employed in the U.S. today. These jobs provide an important source of income for a diverse array of individuals. As the United States population ages and the need for direct care workers blossom, the federal government must consider how its programs foster an environment where more people are encouraged to enter the healthcare workforce. I believe the reauthorization of the Workforce Innovation and Opportunity Act is the appropriate time for this committee to reassess Congress's role in supporting a robust healthcare labor market. In the existing WIOA structure, each state must create a one-stop delivery system that connects job seekers with in-demand jobs. Direct care services should be a part of those state and local workforce development board conversations. But Congress cannot predict the future. Our laws must be nimble and allow each community to address its unique needs. I believe that supporting direct care workers through a comprehensive WIOA reauthorization will give individuals interested in these careers in the direct care field access to programs that will help gain the skills necessary to succeed. Legislation like HR 2999, the Direct Care Opportunity Act, is duplicative to workforce programs that we already have in place. I'm concerned that a new federal program devoted exclusively to direct care workers may threaten the performance of the broader workforce development system. Republicans on this committee want to help all workers, including those in the direct care sector, by strengthening WIOA and other workforce development programs. I look forward to hearing from witnesses today on how we can build up the healthcare workforce sector without detracting from other critical professions. Thank you, Madam Chair. Thank you, and I yield back.
Thank you, Ranking Member Murphy. Thank you, Chair Wilson, very much for those comments. We will now go to our witnesses, and it's my pleasure to introduce them. Thank you again for being here. Really appreciate it. Robert Espinoza is the Vice President of Policy at PIL, where he oversees the National Advocacy Research and Public Education Division on the direct care workforce. Zuma Torres has worked in direct care for over 23 years and works for Cooperative Healthcare Associates, a worker-owned licensed home care service agencies located in the Bronx. Paul Berhami is the head of business development for North America for Udacity, a company, Udacity, founded in 2011 to provide training services for workers facing changing technological landscapes. And Representative Jessica Fay is a third-term member of the Maine House of Representatives. She was appointed to serve as House Chair of the Commission on Study of Long-Term Care Workforce Issues. Our instructions for the speakers are as follows. Again, we appreciate the witnesses for participating today and look forward to your testimony. Your written statement will appear in full in the hearing record, and you are asked to limit your oral presentation to 5 minutes, please. After your presentation, we will move to member questions. The witnesses are aware of their responsibility to provide accurate information to the joint subcommittees, and therefore we will proceed with their testimony. And first, we'll recognize Mr. Espinoza.
Thank you, Chairman, and good morning. On behalf of PHI, I would like to start by thanking Chairwoman Wilson, Ranking Member Murphy, and the other members of the Higher Education and Workforce Investment Subcommittee, as well as Chairman Desaulnier, Ranking Member Allen, and the other members of the Health, Employment, Labor, and Pensions Subcommittee for the opportunity today to discuss the direct care workforce and how the Direct Care Opportunity Act would support this vital job sector. Across the country, 4.6 million direct care workers support millions of older adults and people with disabilities in a range of long-term care settings, from their private homes to residential care homes, such as assisted living, to skilled nursing homes. Most of these workers are women, people of color, and/or immigrants, and 1 in 4 is aged 55 and older, all facts that underscore the entrenched societal inequities that many of these workers face both on the job and in communities. Largely because our country is aging rapidly, the direct care workforce has grown significantly over the years, and it will continue this trend. Between 2018 and 2028, the direct care workforce will add more than 1.3 million jobs, new jobs, including nearly 1.1 million jobs in home care, representing the largest growth of any job sector in the country. Already, the direct care workforce is larger than any other single occupation in the country. However, despite their enormous value, direct care jobs have been poor quality jobs for decades, which harms workers, employers, consumers, and family caregivers. These workers struggle with poverty level wages, which our research shows are lower in all 50 states and DC than wages for other occupations with similar entry-level requirements, such as janitors and retail salespeople. Training and advancement opportunities are also inadequate, which makes it increasingly difficult to recruit and retain these workers. These challenges affect everyone in the long-term care system. Forced into crushing poverty, workers too often leave the sector for other fields. Employers struggle to recruit and retain workers and will need to fill millions of direct care job openings in the next decade. Without enough workers, older adults and people with disabilities cannot access the services they deserve, and family caregivers are often left without paid respite and support. The COVID-19 pandemic has amplified all these challenges. To address these issues, the Direct Care Opportunity Act would provide a significant and much needed investment in the direct care workforce, coordinated at the national level to ensure that funding goes where it is most needed. It would invest more than $1 billion over 5 years in recruitment, retention, and advancement strategies. In direct care, it would require careful planning, needs assessment, and evaluation that would help build the evidence base on this workforce related to care outcomes, employment outcomes, and cost outcomes. Specifically, this funding could be used to support interventions related to entry-level and specialized training, advanced roles, recruitment and retention, supervision, and technology. It could help create new models of long-term care service delivery related to upskilling, care integration, career advancement, and universal worker roles. And it would support individuals with prevalent conditions such as dementia and more vulnerable people, such as people of color and LGBT people, just to name a few. It would help professionalize and transform these jobs, making them more attractive to job candidates now and in the future. Already, the field has designed numerous examples of effective interventions, though it needs significant funding and coordination at the federal level. We have seen successful training, recruitment, and advancement programs in Arkansas, California, and New Mexico, among many other states. And these interventions have benefited workers, consumers, employers, and the economy alike. But they are small in scale, and they represent a tiny fraction of what will be needed to address the national workforce crisis in direct care. I'll close by saying that strategically investing in workforce development for this workforce is also a matter of economic development. High quality jobs and workforce interventions can increase consumer spending, decrease public assistance rates, reduce costly turnover, and promote cost savings in healthcare spending in an already expensive system with costs that balloon every year. We encourage Congress to enact the Direct Care Opportunity Act and begin transforming this critical workforce. As Marisol Rivera, care coordinator at Cooperative Home Care Associates in the Bronx said, I think the role of the home health aide should be considered just as important as any other healthcare role. Thank you, and I look forward to your questions and to your ideas.
Thank you, Mr. Espinoza, and thank you on the time, and thank you for your work as Vice President of Policy at PHI. I need to wear my glasses when I read. I now recognize Mr. Torres, Ms. Torres.
Good morning. Thank you to the members of the committee for inviting me to speak today. My name is Zulma Torres. I am a wife, a mother, and a grandmother. I have worked at Cooperative Home Care Associates as a home health aide for over 23 years. I am also a proud member of the 1199 SEIU labor union. I am very honored to have the opportunity to bring my voice to support your efforts to make our jobs better and help our union. My company employers and training providers provide better programs and services. My training to become a personal care aide and home health aide was intense. Attendance, punctuality were very important. And if you were late or missed a day, you had to make up the work you missed. We learned and practiced demonstrating the required skills. Cooperative wanted to make sure new recruits were serious about the work at first. The job was challenging. I went into strangers' home, introducing myself, and then providing some of the most intimate care and assistance possible. I learned early on that I had to understand my client's situation and put myself in their shoes. I had to separate my personal feelings from my personal responsibilities. My employer, Cooperative, is one of the best, both because it is union employer and is a worker owner. Cooperative supports us, and we have the opportunity to purchase a share of the company. We have financial literacy classes and peer mentoring to help with difficult work assignments. There are also opportunities to become promoted into office-based jobs. Also, I am grateful to be part of the 1199 SEIU union with 60,000 home care workers. In 2018, the union fought to increase our rates to $15 an hour. Now that minimum wage is in New York City. We have health insurance, dental, a member assistance program, and a home care pension benefit. We also have education benefits that cover everything from citizenship program to register apprenticeship to college tuition vouchers. Now, the union is fighting for higher wages and to keep our great benefits. We should be salary workers with guarantee hours. Home care worker is not minimum wage work. The union gives me a voice, advocates for us, and allows us opportunities like this to testify in front of Congress. Today, I'm happy to say that I am a home care worker, and we need more people to come to go into the role so that they can live with dignity in their community and be able to stay in their home instead of high cost emergency rooms visit and hospitalizations or be moved into an institution. We need to make home care jobs good union careers with opportunities for care for careers, advancement of a higher wages. The quality of the job must improve with excellent recruitment, training, scheduling, and a good supervision worker opportunity so they stay in the field. This is why President Joe Biden committee to investing in home and community care jobs and providing workers with better opportunities to join unions as part of the Build Back Better plan. It's so exciting. Finally, I am happy that home care and community care workers are being treated as essential workers that we are. Thank you.
Thank you, Ms. Torres, very much. Thanks for being here. We'll now go to Mr. Berhami. Ms. Berhami, you're on for 5 minutes.
Thank you. Good morning, Chairwoman Wilson, Chairman DeSaulnier, Ranking Member Murphy, Ranking Member Allen, and members of the subcommittees. Thank you for the opportunity to appear before the subcommittees to discuss workforce development in the United States. I serve as Head of Business Development for Public Sector Partnerships at Udacity, an online education platform committed to preparing the nation's workforce for the careers of the future. In today's world, technology is advancing at an accelerated pace. Corporations have invested about $2 trillion in digital transformation to avoid getting left behind. Leveraging these technologies requires them to adapt, but executives consistently rank the shortage of skilled talent as their #1 risk factor. But they're not the only ones with something to lose. A recent McKinsey report has estimated that automation will displace up to 800 million jobs by the year 2030. Many of these jobs will be in the US. If we don't plan appropriately, that skill gap will widen, causing irreparable damage to our economy. At Udacity, closing this skill gap is what we do. We design our curriculum with tech industry partners like Google, Amazon, Microsoft, and IBM. We deliver it through our nano-degree programs, which provide instruction for employable technical job skills in fields like programming, data science, cybersecurity, and artificial intelligence. These programs include both coursework taught by the experts and hands-on projects for students to demonstrate competency as practitioners in their field. Udacity has educated over 15 million learners worldwide. We work with over 110 corporate clients, companies like Shell, Credit Suisse, Airbus, Mazda, and the US Air Force. They trust us to help their employees acquire the skills needed to accelerate their company's digital transformation. And in the public sector, we upskill government employees, we build partnerships for social impact, and we run ambitious workforce development initiatives. The reauthorization of the Workforce Innovation and Opportunity Act, or WIOA, presents a world of possibility. Our workforce system has successfully trained millions, but it needs to be modernized. Employers still face challenges hiring and retaining skilled talent, and millions of unemployed and underemployed Americans deserve a chance to land in a motivating career with growth potential. To unlock this possibility, we can start with proposed structural changes. WIOA maintains a vast array of data about education providers, their programs, and performance. But these systems use outdated mechanisms and are siloed by state, creating administrative burdens. Funding is mainly allocated locally to distinct workforce areas, raising barriers between employers and citizens across geographies, including those aligned to remote work. Let's envision a WIOA system in which funding, governance, and operations are all executed at a more aggregated level, and support that with incentives for neighboring workforce areas to collaborate. Providers could better tailor their solutions to fit market needs. The system would enjoy better budget utilization, helping it educate more citizens. And job seekers would benefit from more diverse choices in the marketplace. Next, we'll look at channel investment. Among the diverse WIOA stakeholders, consider community colleges, for example. They have a history of thriving in the US workforce system with strong employer connections, but they also have gaps in their curriculum, which could be addressed through partnerships with other providers. Another example is the relationship between workforce boards and the public. They sponsor programs that need to inspire citizens to summon all their motivation and commit to self-improvement. It's a pretty tall order. A more modern WIOA would increase its focus on marketing and operations to help the public better understand the role of the workforce system and the opportunity it can deliver. This would improve the utilization of WIOA funds, speed up the delivery of solutions, and create a better fit between citizens' needs and the programs they pursue, leading to better performance outcomes overall. Finally, a word about labor market innovation. The pace of technological change has created ripple effects that impact many facets of modern life. Consider the word ransomware, which has permeated our daily news cycle. In 2014, the first year of WIOA, it was barely a part of the public lexicon. But this world is changing faster than ever before. Investing in pathways to high growth occupations helps to ensure that as trends like ransomware evolve, our solutions to combat them evolve even faster. This fast-paced evolution also causes collateral damage in our communities. Some learners might just worry about graduating, but others have a host of curveballs to worry about. Maybe they lack healthcare or they can't find a babysitter. Maybe they study from the one corner of the house that gets a free Wi-Fi signal. The WIOA of today incentivizes important outcomes, but many people in distressed communities are structurally disadvantaged from achieving those outcomes and get turned away. The WIOA of tomorrow should level the playing field for them too. We're here today because we know what the US workforce system is capable of achieving. A more modern, dynamic WIOA could help to fulfill that potential. Thank you for listening and for joining the cause.
Thank you so much for your time. Thanks for your timeliness. And that will bring us to our final witness. We'll now hear from Representative Fay. Representative Fay, the floor is yours.
Thank you. Good morning, Subcommittee Chairs DeSaulnier and Wilson, Ranking Members Allen and Murphy, and members of the subcommittees. I'm Maine State Representative Jessica Fay, and I represent House District 66 in the Maine Legislature. Thank you for inviting me here today. In 2019, I served as the House Chair of Maine's Commission to Study Long-Term Care Workforce Issues, and I'm pleased to be able to share some of our findings. Because Maine is the oldest state in the country, we are seeing the crisis build and be exacerbated by the COVID-19 pandemic. I came at this issue with an open mind as a legislator, but also as a consumer and a family caregiver. Statistically, most of us will need some form of assistance with activities of daily living during our lifetimes. In a pre-pandemic visit to a local high school vocational program, the director gave me a tour. The classrooms for coding, carpentry, and automotive were busy and full. When it came to healthcare, there were only a few students, notably all female, in the class. As we walked away, I asked about participation in their CNA program and learned that it was declining. I asked why, and his answer really disturbed me. He said, "Kids are smart and don't want to go into dead-end jobs. They understand the earning potential of various professions and choose their paths based on that." If the public perception is that caring for older adults and people with disabilities is dead-end work, then an important part of the solution is to change that perception. We must address not only the workforce challenges, but also ageism and ableism that leads to the devaluation of the care necessary for older people and people with disabilities to live their best, most independent lives. When we have an undervalued workforce caring for an undervalued population, we have a system that doesn't work for anyone. Increasing the pay for essential caregivers is a necessary component of attracting and retaining a diverse set of people to do this economically foundational work. It's a necessary piece of the solution, but not sufficient on its own to solve the crisis we face. Another barrier is that this workforce is seldom included in conversations about economic development. In the quest for high-paying jobs, the foundational jobs are often left out of the conversation. It's important that when designing programs for economic development, we include caregiving jobs as a career choice. During the pandemic, the lack of childcare had a significant impact on local economies as people left the workforce to care for their children. This is also true concerning care for older family members and people with disabilities. Professionalizing the workforce by offering ongoing paid professional development, supportive supervision, and opportunities for advancement in terms of both responsibility and compensation were all recommendations of the commission I chaired. This will enhance the efficacy of programs designed to attract and retain direct care workers. Making sure personal care workers are considered part of a care plan and care team will aid in elevating the status of the work that they do. With some guidance, educational facilities could develop and target education and certification programs for direct care workers. Apprenticeships, earn as you learn, and pre-apprenticeship programs are all ways to enhance the workforce. Creating a path to professional growth through career ladders will also be a critical piece of the puzzle. Funding is a significant barrier to implementing the committee's recommendations. Main care, known as Medicaid, what Medicaid is known as in Maine, main care providers are barely scraping by and even closing. They don't have money to train or do professional development with their workforce, let alone offer career advancement opportunities. Access to funding for training and retention and developing methods to increase the workforce as proposed in the Direct Care Opportunity Act would certainly increase our ability to care for Mainers who need it. In Maine, there are over 2,000 older Mainers and even more Mainers with disabilities who cannot access services they qualify for. There are empty beds in nursing homes and assisted living facilities due to staffing shortages, and people are spending longer time than necessary in hospitals because there's nowhere to discharge them to. Maine is a small state with a population of 1.3 million people. We're older and more rural than any other state in the lower 48. We have significant work to do to address this crisis and to elevate and value the work that so many find so rewarding, yet difficult to make ends meet doing. We need to use many different strategies to make a change, and I'm grateful to the members here today for recognizing there's a crisis and who are working to craft solutions that will allow caregivers and those they care for to live their best lives. Thank you.
Thank you, Representative. Thank you for your testimony and your work and your commitment in this field. Under Committee Rule 9A, we will now question witnesses under the 5-minute rule. As this is a joint subcommittee hearing, after the chairs and ranking members, I will be recognizing subcommittee members based on seniority order of the full committee. I will be followed after my questions by ranking member Allen, and then Chair Wilson, and then ranking member Murphy. So let me begin. Again, Representative Fay and all the witnesses, thank you so much for your testimony. For a lot of us, we've experienced this with our parents and friends and neighbors and loved ones. My mom passed away a couple of years ago at the ripe old age of 94, and my siblings and I were all very engaged in taking care of her. And it was a struggle. And when her last 5 years, when she was in a nursing home after she lost her independence in San Francisco, I had multiple conversations with the staff there and with the employers of the difficulty of trying to provide services in that setting in a high-cost area like San Francisco. But equally, as someone who was involved in our public authority in the county that I represent and represented as a county supervisor many years ago, the challenges to provide for this care is really daunting. So thank you all, and thank you, Representative Fay. I wanted to ask you a question, Representative Fay. With the Olmstead decision and the ADA, our understanding of the position of people with disabilities in America has changed, and our social context has changed. The social model has changed dramatically from when I was young. We live farther apart from each other. Families are not always able to provide care and support. Can you talk about the importance of strengthening the direct care workforce and meeting the goals of the ADA and meeting the needs of people with disabilities and the aged, particularly in the context of this changing environment where young people and family members have economic pressures of their own to travel further and further to get employed, and they have to move employment frequently. So the social model having changed, seems to me that we're slowly trying to adapt to this new social model that doesn't have families as closely located where traditionally they would provide many of these support systems.
Thank you, Mr. Chair, for the question. The goal of the ADA is to allow people with disabilities to live as part of our communities with with barriers to that participation removed. And I think if you require assistance in order to do that, and then there's no one there to provide that assistance, whether it's personal care, transportation, or other activities of daily living, then you're really unable to fully participate. And so a direct care workforce shortage really is in opposition to the goals of the ADA.
Thanks. I want to ask you, as somebody who served in local government and in the state legislature and at the federal level, this difficulty of our roles and the genius of our founders and having local control, but also having a United States, and coming from a large state, the largest state, challenges, and from a large county in an urban area. As one of the ranking members mentioned, Mr. Allen, I believe, the importance of making it fit for the local community. What do you think is the appropriate role, again, in this very demanding, changing social model, the right role for the federal government to play in this regard, so that we can have a really effective conversation with our partners at the state and local level?
I think that's a really good question. And I think the word partnership is really important. Maine is a state that values our local control a great deal. I will say that one of the significant barriers for us implementing any of the direct care workforce reforms that my commission recommended was funding. And I think allowing programs or funding programs, pilot programs that would allow us to do some evidence-based work on what is successful could be really, really helpful. But I think the term partnership is a really key word.
Thank you for that. And I would say one of the challenges with, I agree with you, the pilot programs, but at a certain point you have to bring them to scale. And I always found that was one of the biggest challenges. We were behind that. Great ideas, but actually deploying it and having it be client-based strikes me as a real struggle. And of course, those goes to some of the comments we've had earlier. With that, it's my pleasure to recognize the ranking member of the Health Subcommittee, Mr. Allen, for your 5 minutes of questions.
Thank you, Mr. Chairman. Can you hear me okay? I think I'm unmuted. Good.
Nope, you're on.
Okay, great. Super. Well, listen, thank each of the witnesses for your testimony. I have firsthand experience with this and dealing with my mom and dad and my wife's mom and dad. And it's difficult. But I do believe that it's important that it not be a top-down approach, that it be a bottom-up approach. And that's why I want to work with the states and all of our local communities to solve this problem, which is going to grow, as our chairman reported. It's going to be, as our population ages, it's going to be more and more significant to our responsibility to take care of folks, and I'm getting there in our golden ages. But Mr. Berhami, the COVID-19 pandemic revolutionized the doctor-patient relationship by accelerating the use of telemedicine and further integrating technology into treatment models. However, the modernization of this part of the healthcare industry could unfortunately leave some healthcare workers behind. What are you and other similar education providers doing to make sure that healthcare workers have the tools and skills they need to adapt to technology and thrive during this period of rapid modernization?
Thank you for the question, Congressman Allen. I think that we need to appreciate it's a relatively low-tech problem that we're solving for. We all, as individuals, can relate to the inconvenience of sitting in a waiting room, waiting some unexpected amount of time for treatment. We know how hard it is to fit an appointment into a busy workday or to juggle that with other constraints. And I think that to some degree, we have to appreciate that due to the COVID-19 pandemic, as with many technologies that were adopted to adapt to this change, the genie's out of the bottle. And as a result, the conveniences, the benefits of telemedicine have now become, let's call it mainstream. As a result, I think what's important is to appreciate the benefits of it, the ability to lower costs, to reach more patients, and in the process, make life less burdensome for practitioners and patients alike. As with respect to your question around upskilling healthcare workers to this rapid modernization, I think it really comes down to, I believe it was Chairwoman Wilson made reference to career pathways in her opening statement. And I think that's an important concept to appreciate the fact that these individuals have spent years, decades even, really entrenched in the system. They understand care innately and intuitively. And for those that have a desire and an appetite to advance in their career, perhaps using the insights and perspectives from direct care in order to contribute to the modernization of the industry, we look at that through the lens of nanodegree programs that my company represents at Udacity. However, I think more broadly speaking, we all just need to appreciate that skill development is an industry agnostic topic. The skills shortage is affecting all sectors and represents a massive opportunity, but what comes with it is the risk of being left behind. And so anything which provides that growth opportunity, we are in favor and hope to support.
I remember talking to my mom and dad, checking in with them, and I said, "What'd you do today?" And they said, "We spent the day at the doctor's office." And that was a regular occasion. As far as the ransomware and cyber attacks that have wreaked havoc on our hospitals and healthcare systems, recently a hospital just outside my district experienced a ransomware attack. From your experience, what can Congress do to improve data security, especially when it comes to health data, and how can we better educate healthcare workers to protect and secure patient health data? And we got about 34 seconds.
Big topic for 34 seconds. But what I would say is at a high level, we need to think about basic hygiene for safeguarding data. It comes to having a basic skill set broadly applied to a workforce that people understand how to lock down internal systems, but we also need to create governance models and accountability so that there is a clear sense of how this can be done at scale.
Great. Thank you, sir. And with that, Mr. Chairman, I'll yield back.
Thank you, Mr. Allen. You're a fine son. And now recognize Chairwoman Wilson for her 5 minutes of questions.
Thank you so much, Chair DeSaulnier, and thank you to all of our witnesses for lending your expertise and time. Mr. Espinosa, you emphasize career advancement for direct care workers with 30% of funds reserved for career advancement activities. In your written testimony, you described examples of promising career advancement and career pathway initiatives. Tell us, what are the challenges to developing career pathways and advancement opportunities for the direct care workforce, and how can we develop additional rungs in the career pathways that offer meaningful increases in pay and responsibilities and incentivize long-term retention?
Thank you for the question, Chairwoman. I think part of the problem is in our failure as a sector and as a country to understand the value that direct care workers offer and to create meaningful career advancement opportunities for them to contribute more to the care team and to optimizing the health of the clients and residents that they support. I think in most settings, the next formally recognized healthcare title above home health aide and nursing assistant positions is a licensed practical nurse. And yet too often, arriving at that level requires weeks and months, years of training, I should say, and specifically to get into those roles. and to be able to offer those opportunities. And yet there are a number of ways in which we can create advancement opportunities that keep workers within the direct care sector. We also know that a lack of career growth opportunities contributes to poor job quality. It has been identified really as a barrier to attracting new workers and to retaining workers over time. And so it's really important that we create these opportunities within elevation in title, function, and compensation. Some examples within direct care workers can advance into peer mentors where they're supporting fellow workers and integrating them into these roles. Care coordination so that workers are communicating changes in clients' conditions and symptoms to other members of the healthcare team, and also into internal administrative positions such as assistant trainers or clinical coordinators. One example is that in 2015, PHI created a Care Connection senior aid role following 240 hours of training, specifically in chronic disease knowledge, communication skills, enhanced observe, record, and report skills, and care team participation. Home health aides were elevated to salaried Care Connections senior aid roles. They made home visits to support the upskilling of hundreds of entry-level home care workers, and they helped improve care transitions, solved caregiving challenges in the home, and our evaluation showed that from the initial 18-month demonstration project, there was an 8% reduction in the rate of emergency room admission among the 1,400 consumers impacted, reduced caregiving strain among family members, and improved job satisfaction among home care workers. The challenge for our field is there are not enough of these career advancement opportunities in this country to really grow to scale and to meet the growing demand that consumers and workers need and deserve. Also, we need more coordination at the federal level. Where are the gaps within career advancement opportunities and advanced roles that our government should invest in?
Thank you so much. Ms. Torres, you have been in the field a long time, and we know there's a very high turnover and few workers stay in the field as long as you have. How do you think the high rate of turnover impacts the quality of care for individuals receiving long-term care? And how do you think turnover impacts your job satisfaction? Do you think it makes your job more difficult?
I know that a lot of home health aides stopped working during the COVID, and some clients refused services because they were afraid of infections. It was and still is difficult. For me, I have a great team, all of us who care for our current clients that have a lot of need to get overnight care. We work together. It's difficult. It's a difficult job. So we have to find joy and satisfaction in our work. Still, many workers, myself included, thinks that we should be paid more. We make a lot of sacrifices, and our job has been more difficult since the COVID. We have to put a lot of extra time and effort to make sure we are safe and our clients are safe and our families are safe. For me, I care for my patient. I never stop coming to work.
Thank you so much. Thank you. I yield back.
Thank you, Madam Chair. We will now recognize the ranking member. Mr. Murphy, the floor is yours.
Thank you, Chairman. I just kind of want to reiterate a few of the comments that were just made, because I've dealt, as I've said before, just as a physician with direct care workers for over 30 years. And I truly, truly understand the dedication and devotion and difficulty that these individuals have in their workforce. We're going to be faced now with a growing, aging population. Also, a lot more families are scattered, where in Eastern North Carolina, where I live, there are a lot more families that are staying close, and so other family members can take care of other individuals. But in other areas of the country, that is just not the case. And so the increase in need for our direct care workers is going to increase exponentially. Actually now, as I understand, it's the second largest occupational group in the United States after retail sales. And we're going to have a problem in the future, really, if we don't fix this problem. Obviously, we talked about turnover. Turnover can be 50% in a year or 80 or 90% in 2 years. So there's a massive turnover. I've really seen, however, firsthand how dedicated individuals can truly, truly help those at home. They decrease emergency department visits, they save money, But then on the other hand, sometimes the quality is not that great, and it actually affects poorly for patient care. So I just really appreciate the problem that we're facing. Mr. Berhami, let me just ask you a question. As you noted in your testimony, only 7 of 10 learners programs actually graduate from the WIA program. While this completion rate exceeds that of a lot of post-secondary institutions, it's Congress's job, and this is what our job is, to ensure that taxpayer dollars are spent efficiently and effectively. In your testimony, you mentioned that a learner's incentive to persevere through a challenging program can be diluted when their own money is not invested. Do you have any suggestions about how we can reform the system to essentially give folks skin in the game, to allow individual buy-in that would also not exclude low-income individuals from participating?
Thank you for the question, Congressman Murphy. So I think it's an important discussion, right? Because 7 out of 10 is a standard for the US workforce system, and it's a classic case of glass half full, glass half empty. We certainly like to see that a majority of these enrolled students are making it through, but it does beg the question, what's holding back the other 3 out of 10? I think that one thing that's important is to look at the training providers themselves and understand what are the interventions and support and wraparound services that they are providing in order to sort of optimize those rates. It's not enough to just open a textbook and study. That didn't get anyone through college. And nowadays, it's not enough to click on a video and watch it. We need to participate, and we need to get our hands on the learning. Project work that creates practitioner level skills is one of our sort of mantras at Udacity. The other way to look at this is, let's take a page from the book of traditional higher ed. Financial aid has very clear channels of engagement. We have merit-based financial aid. We have need-based financial aid. This really is a model that we could look at for short-term or non-traditional credentials. And I do think that a combination of all of these factors would help to maximize those outcomes and get more value out of these tax dollars.
Well, thank you for the response. We do have a challenging problem in front of us. As I said, as we age as a nation, as we grow as a population, we're going to need more of these individuals, and the turnover rate that we've noted is just not acceptable, because it leads to a deficiency in care for these individuals. And when they're being taken care of, a family member who's far away from children, et cetera, you want to leave them in good hands. So thank you for your comments, panel members. I'm going to actually yield back. Thank you, Mr. Chairman.
Thank you, Dr. Murphy. Appreciate all of those comments. And now we will go to the distinguished gentleman from Connecticut, Mr. Courtney. And after Mr. Courtney, Mr. Wahlberg is next in the queue. Mr. Courtney, the floor is yours for 5 minutes.
Thank you, Mr. Chairman, and thank you to the witnesses to talk about, obviously, an issue which is even bigger than COVID with the aging of our population, but certainly COVID, I think, put the spotlight on why the direct care workforce, is so essential for the country. As we sort of talk about strategies to enhance and strengthen that workforce, I think it's important for a moment, at least, to look at the American Rescue Plan, which was signed into law on March 11th by President Biden. One of the key components of it was to boost the federal match in the Medicaid program, FMAP, by 10% for home and community-based services. Again, it sort of tracked somewhat the CARES Act, which again was a very bipartisan bill where Republicans and Democrats supported increasing FMAP, but again, it was for a temporary period of time, and it was for the whole Medicaid program. Again, what we did in the rescue plan was surgically target that increase to home and community-based services. The state of Connecticut just released their plan a few days ago in terms of how they propose to use the allotment we will enjoy as a result of the rescue plan. And will come as no great surprise that most of it is going to go into provider rates and also targeted increases in terms of wages. It's not a short-term cliff. They've actually come up with a way to sort of extend that out to 2025. But clearly, Representative Fay, talking about her experience, with the pecking order of direct care employment is for job training is sort of dead end. I mean, if we're going to have a strong demand signal for people who are contemplating going into this. We need to push out the American Rescue Plan match to make sure that that financial base is going to be there. Again, I chaired the Medicaid committee back in the day when I was in the Connecticut legislature, and I know how that is now the biggest line item in Connecticut's and most state governments. Representative Fay, what would it mean to have again a targeted boost for FMAP for Maine, as was contemplated in the Families Plan bill from the president, to really provide again the financial underpinning so that we can implement some of these changes?
Thank you, Congressman Courtney. I think it would be a wonderful opportunity. I think one of the biggest barriers that we identified as a commission were reimbursement rates. So our main care reimbursement rates for the work being done by essential caregivers was in some cases less than minimum wage. And one of the things that the 10% FMAP bump has allowed is, and our plan hasn't been completely released yet, so I'm not 100% sure of what's going to be in it, but I do know that there will be some one-time bonuses for people who have been working to be able to continue to pay them a higher wage and to reimburse providers at a higher rate, and a rate that allows them to compete with other sectors, hospitality and retail would be huge, because right now we're just not reimbursing them as if we value the work that's being done.
Well, thank you. And again, at some point, to try and tell a young person, you should go into a training program for, home health care or, institutional health care. But the financing system is just going to lapse back to its prior sort of state, is just not, going to really get people's blood excited. The other just point is, we passed HR 447, which was the National Apprenticeship Act earlier this year, which would size up the Fitzgerald Act apprenticeship program to get into healthcare as a way of getting not just pre-apprenticeship training as contemplated by WIOA, but also full apprenticeship training. So people really have that earn as you learn ladder to acquire more skills. And I mean, would that model work, again, based on your experience, Representative Fay?
I do think so. I think one of the things that would be helpful to providers is to allow their employees to work. And if you can earn while you're working, I think that would be a wonderful thing.
Great. Thank you. Thank you, Mr. Chairman. I yield back.
Thank you, Mr. Courtney. Thanks for being so punctual, and thank you for not bringing up the Red Sox during your testimony. Questions. We will now go to Mr. Wahlberg, who will be followed by Representative Bonamici. Tim.
Thank you, Mr. Chair. This is an important topic, of course, and appreciate the panel being here. And we could go all sorts of directions, but let me go to Mr. Berhami. One of the things I hear from employers across my district is that today's college graduates don't always have the skills needed by employers for in-demand jobs. In your testimony, you note that community colleges maintain strong employer relationships, which keeps them firmly rooted in the WIOA system. And you indicate that WIOA funds could be enhanced by allowing community colleges to reach out to non-traditional educational institutions to fill curriculum gaps. Could you elaborate a little more on what you mean with this recommendation?
Sure. Thank you, Congressman, for the question. I think it's an important topic because, as we know, in a diverse marketplace, there are always going to be point players, and it's certainly not a case where you have one-size-fits-all solutions. So starting with community colleges, their strengths are hyper-local relevance, right? They have been pillars of that community that they serve, which means strong relationships with the employers endemically very well entrenched in the WIOA system, but they suffer what a lot of institutions of higher learning suffer, which is the natural cycle of generating the learning content that is timely for the environment in which students are learning it. So we use the example of cybersecurity, which came up earlier in this hearing. This is literally changing every day. Every attack, every response is an evolution, and a pretty radical one in some cases. And so the need to be able to time the delivery to market as quickly as possible becomes important. Who better than a specialist provider of that learning content to partner with said community college to be able to allow both entities to play to their strengths? Hopefully that helps shed light on my earlier testimony.
Yeah, I think that's important to understand that we have capabilities, and if we promote flexibility in our educational system that meets the needs of the real world, as opposed to turf, that could be a significant help to us. You note in your testimony that Udacity works with over 200 industry experts, including companies such as IBM and Amazon. Can you describe the value of partnering with employers when developing course curriculums?
There are a range of reasons why this is important from a partnerships point of view. I'll speak to two of them. The first one I touched on a moment ago, and it comes down to the refresh cycle. Technology is changing so fast that in order for this information to be timely, we need to minimize middlemen, so to speak. It's the same reason that Encyclopedia Britannicas are disappearing from shelves around the homes nationwide, because the format and the vehicle for information dissemination has now become a barrier. And so having direct access to the engineers, the creators of those technologies, allows us to deliver that faster to market. The second is really, it comes down to credibility. We at Udacity don't consider ourselves to be the voice of cloud computing or artificial intelligence or machine learning. There are plenty of technology companies out there who have earned their place as the authorities on that. What we do is we structure effective programs. We invest in pedagogy and research to scope and run these programs. And therefore, by bringing in a technology partner, it adds credibility and creates a greater impact.
Makes all good sense. Again, turf is a key issue, but in flexibility with creativity. Finally, Ms. Berhami, as the economy recovers from the COVID-19 pandemic, it's critical that we assist the unemployed, underemployed, and dislocated workers succeed in transitioning to in-demand full-time employment. How can Udacity, through its partnerships with industry and workforce boards, help this effort?
Really, it's a complex answer because there are so many resources at our disposal. But just for the sake of simplicity, what I will say is that we aspire to make use of the infrastructure that is laid out in front of us. We look to provide job-ready skills so that there is something of value that these individuals carry with them out of their credential. And we measure as much as possible to make sure that we optimize our programs for maximum lifelong impact.
Thank you. I appreciate it. And Mr. Chairman, I yield back.
Thank you, Mr. Wahlberg. We will now recognize the distinguished member from Oregon, Ms. Bonamici.
Thank you so much to the chairs and ranking members, but truly thank you to the witnesses for being here today to discuss this important issue. Throughout the pandemic, I've spoken with direct care workers who put their lives at risk caring for our loved ones. And unfortunately, despite their heroic efforts, their work is far too often underpaid and undervalued. We know most home care workers are paid poverty level wages. They lack access to training and support services and do not have access to paid sick time or other basic benefits. 44% of direct care workers live in low-income households, and 42% need to rely on some form of public assistance. These working conditions have a disproportionate effect on the more than 86% of direct care workers who are women, nearly 2/3 of whom are women of color. In Oregon, my home state, home care workers and personal support workers gained the right to form a union back in 2000, and through successful organizing and collective bargaining, workers have raised their base pay. They worked with the state to provide a new model of health care for home care workers that provides premium assistance, out-of-pocket expense assistance, as well as dental, vision, and employee assistance benefits for eligible workers. SEIU 503 also recently launched an innovative program to provide workforce training opportunities for direct care workers. Your CareWorks program is the first registered apprenticeship program for certified nursing assistants in the state, and it focuses on mentorship and support services to strengthen retention in the workforce, which is so critical. But fair wages and benefits should be available to direct care workers, not just in Oregon, but across the country. Ms. Torres, you in your testimony noted the barriers you faced accessing quality training when you started your career as a home health aide. So was the training sufficient to provide you the skills you needed to succeed? And how would access to supportive services like childcare and transportation change? How would that have changed your experience?
Can you repeat the question?
Yes, Ms. Torres, you noted the barriers that you faced accessing quality training when you started your career, and how would access to supportive services like childcare and transportation change the experience? Or how would that have changed the experience for you? I could rephrase it and say, would supportive services like childcare and transportation be important to people who are learning and training how to be a home health care worker?
I'm sorry, can I?
Don't think she's.
Sorry.
Here we go.
Sorry, I don't have the answer, but I'll give you my point of view.
Okay, yes, of course.
Yes, we had a very great, I had a great support team from Cooperative Home Care. Our training was intense. They were excellent. They made sure that we knew what we were doing. If we missed out on anything, we'd have to make up the time, because they wanted us to go out there knowing exactly what we were doing. And out of a lot of companies, we get a 4-week training and it's intense. We take two tests, and it's awesome because we go out there prepared. Even though we become a little afraid when we're in the field because we don't know where we're going, and it could become a little bit stressful. But once we get there, we access to the client and we make it comfortable and clear, not cluttered for them so they won't fall, and we get to know one another and we build from there.
That's wonderful. Thank you so much. I really appreciate your being here today to share your story. And I want to get a question for Mr. Espinoza. I often speak with direct care workers in Oregon about the challenges for career development and with employers about retention. So how can states better leverage local resources and partnerships with community colleges and other programs to improve the workforce development pipeline for direct care workers? And how can this committee better incentivize the development of career pathways and support services to encourage workers to stay in these very important jobs?
Thank you for your question, Congresswoman. Creating a strong pipeline and addressing retention and reducing turnover, I think, are some of the goals that the interventions that the Direct Care Opportunity Act would fund would specifically address. I mean, we know that oftentimes providers name caregiver shortages and caregiver turnover as the top threats, and the cost is expensive. It's $2,200. It impacts quality of care and it impacts workers. We have seen across the country a variety of interventions that have improved retention, and this act would specifically support those kinds of programs and help us build the evidence base.
Thank you, Mr. Espinoza. And I know my time is about to expire, but just on a personal level, I spent a couple of years taking care of my mom in the last years of her life in various levels of assisted living and skilled nursing facilities. And the turnover is a serious, serious issue. It affects the quality of care. It affects the continuity of care, and it's expensive for the employer. So we need to do all we can to improve these positions so that people stay in them and they really are valued for and paid and valued for the very, very important work that these direct caregivers provide. So, and I yield back the balance of my time. Thank you.
Thank you, Ms. Bonamici. And we'll now go to Mr. Grothman for 5 minutes.
Okay. You hear me?
Yep.
Okay. Mr. Berhami, I have a couple of general questions for you. First of all, I know a lot of the problem, or at least when I talk to my local providers, they feel a lot of the problem is caused by people right now staying out because of the unemployment. Is that what you're seeing? Is this a nationwide thing or is this in Wisconsin?
So I want to make sure I understand this question, Congressman. Is the question about the unemployment safety net creating sort of a different environment, which is driving decision making?
Well, yes, decision making of potential employees. I mean, be I talk to home care, be I talk to anybody in that field, therapy places, retirement homes, that sort of thing. They all tell me the same thing, that they're having a bigger problem finding people in the last year because of the excessive benefits. Is that so?
So I think that this is probably a topic better addressed by a labor economist. I can tell you that from our point of view, we have seen pretty steady demand for our programs. And whether or not the baseline, has the floor been raised, has the ceiling been raised, is probably more of a macroeconomic discussion. But what I can say is that with respect to skill development and that aspect of the unemployment safety net and the benefits that are afforded to people that are out of work, underemployed, low income, et cetera, especially under the guidelines of WIOA. The COVID-19 pandemic has certainly created a surge, but we also have seen that there really is a lot of baseline demand, which probably reflects conditions that predated the pandemic by a long span.
Do you see people looking for training in these fields who already spent time in a traditional four-year university?
Yes, we do. The reality that I believe we're all facing at this point is that education is not a one and done milestone. We tend to think of the span or the arc of a lifetime. You're born, you graduate, you get married, you have kids. This is not a pillar of our lifestyle. Lifelong learning really is the new normal. And we're not in an environment where a single degree is really appropriate or less.
I guess what I'm saying, is it apparent to you when someone with a four-year degree comes there that they would have been better off, rather than getting involved in your field at age 25 or 30, better off being trained for this sort of job when they were 19 or 20?
I would say in some cases, yes, that would be the case. However, we also need to realize the fact that this journey of educating oneself also has many twists and turns. How many people in this meeting knew what they wanted to be when they grew up at various ages? I think that what we could say is, in hindsight, in some cases, it might have been a better investment to go into a short-term training program, maybe an apprenticeship, and save the tuition, the opportunity cost of a four-year degree. But right. To be honest, there's a realm of opportunities and it's a vast marketplace.
Well, I would think so. I mean, do you see people going through your programs that have not only a four-year degree, perhaps, but a student debt associated with that degree?
Absolutely. In fact, one of the drivers for entry into one of these programs is that a lot of the alternatives involve taking on more debt. And I believe that's the individual calculus of any person who decides to join our program. They think about that.
So if they were in your program, first of all, you could repeat again, how quickly do you go through your program?
4 months.
Okay. So you could be a 19-year-old who already went through your program and is helping out in this vital area of the American economy. You could be doing that without debt, as opposed to even graduating from a four-year, having substantial debt, and then entering your program.
That's absolutely right. And I think the environment that they're stepping into with this credential has become more and more inviting for those sorts of non-traditional educational pathways.
I think we do on a federal level have programs that encourage people to take that four-year degree and not use the four-year degree. Do you think you find that accurate from the people you're dealing with?
I think that there are a range of outcomes, and I think that in some cases that could be the case, but it's becoming a lot more complex.
Okay, thank you very much.
Thank you, Mr. Ruthven. The chair will now recognize the distinguished gentleman from California, Mr. Takano.
Thank you, Mr. Chairman. I want to first begin my questioning with Ms. Torres. Ms. Torres, could you please describe the work you do on a daily basis as a home health aide? Just describe a typical day, the daily work that you do. Is Ms. Torres still here with us? Ms. Torres?
Yes, yes.
Oh, there you are. Just tell us what your day is like. You know, just the daily tasks, the work you do. Like when you get to a particular client's home, you know, what is it? I mean, just you can tell me what that's like.
I do organize. I make sure I remind them of their medication. I assist with meals. I provide companionship. I really love my job. It's very rewarding. Not only the necessary task. I do the necessary tasks that my clients will need to make them happy, to assist them, to see a smile on their face, to know that I'm there for a reason and it's to help them and they appreciate it, especially those that don't have family. So my nights at work is companionship, making sure that my patients are okay, reminding them, making sure they have eaten their breakfast, giving them a sponge bath, grocery shopping for them if I have to, necessary, and making sure they're safe.
Ms. Torres, I mean, how much physical, I mean, is some of your tasks physically, exerting? Do you have to exert yourself physically? I mean, is it physically challenging at times to be able to do this work?
Yes.
It is.
It is.
I mean, maybe helping lift people, or you have to move people around. That can require quite a bit of physical exertion. So it's physically demanding work, is what I'm trying to say.
Yes, it is. I use a Hoyer lift. I have to use my body mechanics to straighten my body, and I have a lot of contact. It's very difficult.
How long are your days typically? How long does your day go?
Well, I do 12-hour shifts.
12-hour shifts?
Yes.
12-hour shifts. And so you'll work maybe 4 days out of the week?
Yes, I work from 8 p.m. to 8 a.m. in the morning. I do 12 hours.
And do you have to is it just one client that you work with, or do you have a number of clients that you go to different places?
Right now, yes, I have one, but as a home health aide, my hours vary and as needed.
Now tell me, I wanted to ask, what was it like during the pandemic? How many, and when the pandemic began, how long did it take before you were provided with proper PPE?
They gave us some in the beginning, but we have a sister union in North Carolina, and they shipped us out a lot of masks and gloves and gowns and shields for us. So we were lucky and we were blessed. It took some time in the beginning, of course, because we didn't expect this to happen. And many of times we had to buy them ourselves until the shipment came in and they were able to give us more. So now going forward, we're pretty well on that.
All right, well, great. Well, thank you, Ms. Torres, for sharing that with us. Mr. Berhami, I just want to ask you a question about the short-term training program. It's a 4-month program. But would you describe the pathways, the training pathway, as one that's stackable credentials? You kind of get the first, and this could lead to a 4-year degree at some point?
So yes, it is a stackable credential. We have nanodegree programs that are structured at different skill levels. And the idea is to create pathways and even to bake in some decisions along the way. It is not identical to a 4-year degree, but there are parallels in terms of the outcomes and the skills.
But it could lead to one.
It is not, we are not an accredited institution, so we don't compare our credential to a 4-year institution's credential.
Okay, I'm over time. I thank you, sir. I yield back.
Thank you, Mr. Takano. The chair now recognizes Representative Miller Meeks for 5 minutes.
Thank you so much, Mr. Chair, and I thank our witnesses. And I think it's an interesting conversation because although I'm a physician in my job prior to Congress, I was started out volunteering in a mental health facility, in nursing homes, then became a student nurse, and then a nurse, and then a physician. So I've had this spectrum, if you will, which interesting that Representative Takano would mention stackable degrees or education that builds upon itself. And throughout that, I've certainly seen healthcare change and also, home care. And one of the concerns I have, and I think, Mr. Berhami, this goes to your point, is one of the key problems in our workforce development system is that we place too much focus on jobs of the past as opposed to the labor market of the future. And I think we in government trying to determine what the jobs of the future are, we're woefully inadequate in doing so. For instance, one of the things the pandemic has showed us as it is slower for people to come back into nursing homes after the events that had happened, especially in places like New York and New Jersey and Michigan, so that there may be a shift in the future from, even though there was already a shift towards care at home, it may be more of a push for care at home rather than in a residential care facility. And at the same point in time, we're seeing an explosion of technology. And so we now have technology that can do blood pressure monitoring at home. I'm an ophthalmologist, so eye pressure, glaucoma pressure checking at home. We can do EKGs at home. You can monitor and use technology to monitor medication boxes if you've set up the medication when a patient has removed a medication or an individual has removed medication from their medication box and whether they've taken it or not. At the University of Iowa, in our aging centers, looking at determining falls. So there's a variety, I think, of, I won't necessarily call it artificial intelligence, but it is in some ways artificial intelligence that's used to help us monitor people without someone physically being there. So to that end, Mr. Berhami, what role does Udacity play in preparing people for tomorrow's workforce, which I think is, as you've indicated, going to integrate AI and other methods of technology?
That's a great question, Congresswoman. Thank you. So I think it starts with understanding, being able to contextualize the industry. So you could look at the long-term growth of an occupation like a health information specialist. They're going to add about 30,000 jobs by 2029, and that's valuable context for the direction of the industry. Earlier, we heard that it is the fastest growing industry. Consider on a shorter term basis that by 2024, more than 1 in 3 new jobs will be in the healthcare industry. Today, that's 2.3 million open jobs, and the top occupations are registered nurse or a personal care aide. You're looking for skills like nursing, CPR, even records management. But I think what we need to do is look at the occupations within healthcare. So if you were to take an occupation code like computer and mathematical, that subset, it's about 50,000 open jobs, but the median salary is about 50% higher. A third of these jobs don't even require a bachelor's degree. And so what kind of titles are we talking about? Business intelligence analyst within healthcare, clinical informatics specialist, and they want computer science. They want programming languages like SQL or Python. They want agile methodology and some of these sort of project management skill sets. So whether it's AI or some other technology that's being applied to the healthcare industry, what we're really trying to do is just solve analog problems from the non-digital world, like physician shortage and the burnout associated with that. All of the data that's been collected for eons in this industry through a clipboard and a ballpoint pen. If we can manage these things at scale through telemedicine, through data science and machine learning, we can get better at removing outliers from our diagnoses. We can get better at trend spotting so that if there's another pandemic around the corner, maybe we spot it a bit sooner. It's very abstract and certainly warrants a longer conversation, but hopefully that helps to answer your question.
Yeah, I agree. It absolutely does warrant a longer conversation. Would love to talk with you more about the data acquisition, the amount of data out, how that goes into population health and public health. But my time has run out, so perhaps in another conversation we could continue this. Thank you so much, and thank you, Madam Chair. I yield back my time.
The co-chair of the committee had to step away to another committee to vote. So I'm assuming the gavel, and I now recognize Chairman Scott.
Thank you, and I thank you for the recognition. I'd like to ask Representative Fay a couple of questions. I thank you for your service. I served in the state legislature, and I know the sacrifices that are made by state legislators. I think you've heard a number of people comment on the disappointment that people feel when they think a CNA is a dead-end position, because somebody moving up to a CNA was just the first step in a long tradition, because you can go from CNA to an LPN, to an RN, and then to advanced practice, midwife, nurse anesthetist, or even an independent clinical practice. And you'd be amongst some of the best paid in the professions in the country. So considering that, a dead end was certainly a disappointment. But you served as on the committee that studied this issue. Did you issue a publicly available committee report?
We did. We did. Thank you.
We'll try to get that, because I'm sure you've got some nice recommendations that we can take advantage of. I was also intrigued when you said that sometimes there's no place to discharge people because they don't have access to direct care. Did you make any attempt to quantify this? How many people were staying in an expensive hospital for the lack of direct care at home?
Thank you, Congressman. We didn't have access to that data at the time we were doing this. And I think the issue has really become exacerbated because of COVID, but it's also really shown a light on concerns. So what I can do is check with our Department of Health and Human Services and see if there is any specific data available on that, and I can submit that in my comments later.
Good, thank you. I'm not sure who this question maybe Mr. Espinosa. Within just direct care, we've got different levels of certification within nursing. Would there be different levels of certification within direct care?
Thank you for the question, Chairman. We would look at the opportunities that there would be advanced roles that would fulfill different roles. So there would be peer mentor roles, there would be care coordinator roles, et cetera. However, the occupations would be within, personal care aide, home health aide, and nursing assistant. We have seen some states adopt advanced home health aid occupations that do represent an elevation in title, in compensation and responsibilities. So there are ways in which policymakers can create these advancement opportunities and different certifications, for example.
And what can be done to make training more available and consistent?
It's a great question. I think, there are a variety of approaches. One is making sure that training requirements are as strong as possible for all occupations within direct care. Right now, only home health aides and personal care aides have a federal training requirement, but personal care aides do not. And so the state requirements for personal care aides vary considerably across state. Certainly we would also argue for the importance of rooting training in core competencies, making sure that programs are training workers across occupations. The potential of universal worker roles, for example, that could be funded through the Direct Care Opportunity Act would be an opportunity to think about what are the core competencies and training approaches that these workers need across occupations so that they could be more portable across setting and in an ideal world across states. So those are the kinds of opportunities that this act could support.
Well, a direct care worker has, just for logistical reasons, a limit to the kind of caseload that they can handle if they're properly trained and getting more money? How would they get paid? Medicaid obviously could increase pay. Does insurance, private insurance, pay for these services?
It does, but in most instances, the primary payer for Medicaid, the primary payer for long-term care is Medicaid. And this is part of the challenge, is that too often what we hear is that providers do not receive a sufficient level of Medicaid funding or reimbursement rates to deliver the services that they need to deliver, and much
Well,
less
we could fix that by just doing it, but you can't just do it to tell private insurance or self-pay in just self-pay, just can't tell them to pay more. Would people be able to afford the services?
No, unfortunately, these services are expensive and most people spend down their assets or income just to qualify for Medicaid.
Good. Thank you, and I yield back.
Thank you, Mr. Chair. And now, Mr. Fulcher, Representative Fulcher.
Thank you, Madam Chairman. Question for Mr. Berhami, if I may, please. Mr. Berhami, I've personally have the belief that a one-size-fits-all model in higher education is preventing more individuals from successful careers. And it seems to me that too often we hear the only pathway to success is through a bachelor's degree in a traditional four-year college path. But companies like yours seem to prove that notion wrong. Could you describe for me, first of all, do you agree? Secondly, if so, what are the types of learners? What's the profile of that learner that participates in Udacity's programs?
Thank you, Congressman. I could not agree more. And I think that that is emblematic of the environment in which we find ourselves in 2021. So to your second question, the types of learners in our program, I would say there is not a specific type. It is a vast, diverse spectrum of learners. So I'll give you some examples. We have some fascinating case studies we've been tracking over the years. A trucker who was sort of dissatisfied with the direction of his career and decided in his spare time on the road to start learning how to code, and gained access to a scholarship program to a nano degree in programming from Udacity, and ended up in a front-end web development career and has completely reinvented himself. Another example I can give you is very different. So this earlier gentleman, I believe, was in his late 40s. Then we've got a kid who's no more than 18, 19 years old, working 2 retail jobs at minimum wage to try and make ends meet, and actually got accepted to a 4-year university, decided not to take that opportunity, and instead gained access to a nano degree program through a partnership we had with Google, landed an internship with NASA, and now is gainfully employed by GitHub, which is a Microsoft subsidiary. We work with learners who are incumbents in corporations, some of those that I mentioned in my opening statement. They're looking to us to drive big capacity building initiatives. So these are employees that are just looking for a way to move up. But we work with distressed communities, dislocated workers from the pandemic, partnering with workforce development boards at a local level in order to find people that maybe don't fit any particular profile other than they're hungry for change. So we try to provide them with a platform to take control of their careers and come out with job-ready skills.
You also mentioned, Mr. Berhami, that in your testimony that the processes for providers to maintain their catalogs of programs is different in every state. I know that we've got some differences in my home state of Idaho, which it creates a number of administrative burdens for new providers. Would you talk to me about that process, the cumbersomeness, if that's a word, of the process for providers to be added to an eligible training provider list, and what changes you might recommend to that process?
Absolutely. This is an important topic, Congressman. So when we think about the structural underpinnings of WIOA, the system needs to know who's training, what they offer, what their performance is, because it needs to maintain accountability. So that is important. However, what we find is that if you choose to engage with one state versus another, one workforce area versus another, some things are consistent and some are not. Some states will require different types of records. They may ask for financial records. For a private institution, that can get a little thorny. They may ask for certified documentation from a company officer. There is a lot of inconsistency in this sort of structural blueprint for the system. And I would say a solution, I would liken it similar to the common application that a lot of people use to get into higher ed. Right? You fill out one application, it gives you access to a lot of different institutions. Maybe that's a model we could look at with the reauthorization of the OA.
Just very quickly, because I'm just about out of time, but I'm going to shift gears right quick. We have this tendency in Congress to throw money at things, and sometimes money is not always the answer. How do we take a reform and tie the connection better between the learner and the taxpayer?
This goes back to my opening statement. Number one, have a more clear-minded, modernized view of what the labor markets of today need. Number two is to create some of those structural reforms. And number three is to invest in channels and facilitate the collaboration between entities.
Thank you, Mr. Berhami. Madam Chair, I yield back.
Now, Representative McBath.
Manning. Now it's Manning.
Representative McBath, Representative Jollapal, Representative Manning.
Thank you, Madam Chair, and thank you for holding this very important hearing. Representative Fay, I found your testimony to be, your written testimony to be informative and thought-provoking in framing the ways we need to professionalize and refer to caregivers. I've also found that so many people lack any real appreciation of caregivers until they need assistance for their own family members. And then it's like an epiphany. And suddenly they realize the importance of having trained professional people in those positions. So I wonder if you could tell us how direct care workers are trained in your state, and whether you have any recommendations regarding the importance of having statewide programs that are focused on providing training to this workforce, both in terms of ensuring quality and also the impact of training on retention and the development of career ladders for this workforce.
Thank you, Congresswoman. That's a big question, and in a big state that is both geographically large, and also we have significant rural populations. I think the answer depends on where you are. So to answer the first part, the training happens depending on, I think, where you are, whether you have access to a vocational program or it's something that you are called to do. The work is work that you're called to do, or whether you're working for a provider or need a job. So our private providers will train personal care attendants. Anecdotally, I've heard that sometimes the training is short and not particularly comprehensive, and I think that's part of the professionalizing of the workforce. So, you know, I'm not trying to give a non-answer answer, but it really does depend on where you are and what resources you have access to and what your motivation is.
Thank you. Mr. Espinoza, one goal of the Direct Care Opportunity Act is to spur investment in new recruitment efforts for direct care workers. And in your written testimony, you described some examples of promising recruitment initiatives. Can you talk a little bit more about the elements of a successful recruitment program? How can recruitment efforts bring untapped labor pools into the direct care workforce?
Thank you for that question. Recruitment is a major challenge for us in the direct care workforce. Generally, we think about the various strategies that employers can use to recruit more workers, from improving the hiring process to strengthening entry-level training, providing employment supports, the kind of wraparound supports that Zolma testified to earlier, promoting peer support so that workers are getting that attention from other workers, and learning about the job from other workers. Also ensuring effective supervision, developing advancement opportunities, recognizing and rewarding staff, and measuring progress. Typically, in a recruitment approach, the approach first looks at how do you attract and select the candidates that are best suited for providing quality services and support, and then they help employers establish the kind of partnerships or boost the kind of partnerships that will help them reach a broader pool of candidates. And really, how do you strengthen an employer's brand? We have seen a variety of retention recruitment projects throughout the country that have really focused on bringing more workers into the sector, from a program in Wisconsin that brings more nursing assistants by training them and then connecting them to employers through partnerships in the field, to an intervention in Minnesota where an assisted living facility in the rural part of the state partnered with a social media firm to develop paid ads to target key markets and drive them to apply online through their mobile devices. So there are a range of recruitment processes that can be used to bring more workers into this sector, and of course, strengthen the retention once those workers take on these jobs.
Thank you. My time has expired. I yield back.
Thank you so much. And now we have Ranking Member of Fox of North Carolina.
Thank you, Madam Chairman. My question, my comments and questions will be for Mr. Berhami. A well-skilled direct care workforce is critical for serving our most vulnerable populations, but adding more federal programs is often duplicative of broader efforts and creates an inflexible system that does not meet the needs of local employers. Rather, Congress should work to reform our existing workforce development system to ensure all workers, including those in health-related fields, have the skills they need for a successful career path. Mr. Berhami, programs like WIOA have the potential to be a flexible and robust workforce pipeline for millions of Americans. In your view, what are the top 3 things in current law preventing this from occurring?
Thank you, Congresswoman. That is a compelling question, and narrowing it down to 3 is my challenge. I would say there is, in no particular order, one important priority is creating opportunities for distressed communities to thrive within this system. So what that means is effectively looking at the outcomes and the standards to which we hold these, appreciating that these populations may be structurally disadvantaged from thriving within the system simply because the way workforce boards are measured works against them and therefore leaves them cut out of the mix. How to do this is another conversation, but one that I think is very compelling and happy to always explore further. The second is the host of structural reforms that I've discussed in my opening statement, as well as in response to some of these other questions. And what I would say is that it goes beyond simply the mechanisms for managing training providers. We also want transparency into the performance data. It's hard to just take a pulse on WIOA and understand what's working and what's not, in which geography, for which learner, et cetera. And so I would propose expanding structural reforms to also include more free access to that data. And then if I had to pick a third and exclude others as a result, what I would do is I would think about how can we look at maintaining individual accountability while also broadening service delivery to a more aggregate level. American Job Centers, for example, are tasked with liaising one-on-one with individuals and really taking a case management approach to letting people into these programs. As the training provider in this equation, we have observed countless times that becomes the biggest bottleneck. It's not a job that can be approached with shortcuts, excuse me. It simply needs to be modernized in such a way that service delivery can be a smoother process. Hopefully that helps to answer your question.
That helps a little bit. And I think making the language a little simpler, you use a lot of big words that I think don't need to be used, and we could use simpler ones. But from your testimony and the answers you provide today, it's clear Udacity serves learners much more efficiently than the federal government does. While our time is limited today, I want to follow up with you after this to better understand how we can focus taxpayer dollars to enhance our workforce development system and help the individuals gain the skills they need for a successful career. And I appreciate Udacity's focus on producing lifelong learners. That's certainly an interest of mine. Our economy is rapidly evolving, as we've talked about, and it's important that individuals have the ability to upskill and reskill. That's very clear in this hearing today. So how can individuals advance their career development with your company? If an individual learns one skill and then desires to learn additional skills in the chosen field, what avenues are there for the person to pursue that goal?
That is an excellent question. I appreciate your compliment and your earlier feedback as well, Congresswoman Fox. I think that it starts with understanding the multitude of options available. Udacity is but one training provider, and we're reaching a point where there are more specialists. People need career guidance. They need to understand what's out there before they can begin to make decisions. We provide career services. On occasions, our programs also include soft skills, so they learn teamwork, collaboration, leadership, and so on. And we feel like this helps to create more opportunities for lifelong learning.
Well, thank you very much. And I hope you'll put more of a focus on education than on the T word, because I think when you use that, you are limiting, very seriously limiting people's options. Thank you very much. And thank you, Madam Chair.
Thank you. And now Representative Morrell of New York.
Good morning. Thank you, Madam Chair, and thank you to both our chairs for holding what I think is a very, very important hearing to discuss this topic, and certainly to all of our witnesses for being here today and sharing their expertise. And I will say also that many of the questions that I had thought about asking have been asked by my colleagues, so I want to thank them. I think this has been a really enlightening conversation. You know, each year, the nearly 20 million adults in the country who need assistance with self-care deserve the dignity of receiving these services in the comfort of their own home. But obviously, as the witnesses have testified, we can't ensure that those services will be provided in an appropriate way unless we have a robust direct care workforce, each of whom receives appropriate pay and has the opportunity to grow professionally within the healthcare system. Just parenthetically, I note I was proud last year to introduce the Senior and Disability Home Modification Initiative, which would have helped support independent living for older individuals living with disabilities. And I was proud to see some of the provisions related to older individuals become law with the passage of the Supporting Older Americans Act. But I know we still have a lot to do when it comes to recruiting an effective workforce and retraining them with proper wages, improved working conditions, and advancement opportunities. I just wanted to make note of a program. It's a federal program, the Health Profession Opportunity Grant Program, also known as HPOG or HPOG, which I think is a pretty effective healthcare training program that helps address workforce shortages for in-demand jobs. The program creates career pathways such as apprenticeships and ongoing training to empower applicants, many of whom are low income, to take on new jobs as nurses and technicians. It also supports many indirect aspects that people must consider, which you talked about here this morning when working in those settings, including childcare, transportation, work supplies, application fees, etc. So the program stands out because it's helped advance the careers of people who have been disproportionately left behind in workforce training programs, especially low-income single women of color, and is more likely to result in a person being employed in a health program upon graduation. The availability of this program has been a particular asset to my community. Action for a Better Community is an organization that receives money from the program, and I've been blessed to be in contact with them, meet with the folks who have gone through the program. I think it's something we should continue to work on. I wanted to just, if I can, ask the question of Representative Fay. I am a proud former member of the New York State Legislature, so I have great appreciation, as many of my colleagues who served in state government, for that role. I wonder how we might be able to utilize programs and how the states might be able to utilize programs like this Health Professions Opportunity Grant Program to leverage funds to improve recruitment and develop defined pathways for career advancement for the direct care workforce. If you might be able to comment on that, not simply HPOG, but as I've described it, perhaps other programs as well.
Thank you. Yeah, and so I'm thinking about that as we adjourned sine die last night, fairly late. So I might be just a little foggier than I would be normally. I would say it depends on the state. So in Maine, our workforce is really kind of disparate, and while our Department of Health and Human Services and Maine Care does the funding at a level where we're talking about home health care, they don't necessarily have a jurisdiction over all of that. I mean, we have credentials and training. So I think,
yeah, let me ask this, Representative. Would it be helpful in terms of thinking of it, and do you think about it in terms of creating rungs on a career ladder so that people come in terms of skill set, having relatively few skills, but continue to work up and have them more defined? Would that be helpful? And is that something you think about in your responsibilities?
Oh, absolutely. I mean, that was definitely one of the recommendations of the commission that I chaired. And any assistance and guidance in making that happen, I think would be helpful.
Very good. Well, Madam Chair, I have a lot of additional questions, but I appreciate very much the hearing. I see my time is up, so I will yield back. Thank you.
You may submit them for the record if you want answers.
And we will do that. Thank you.
So ordered. And now Representative Banks, Indiana.
Thank you, Madam Chair. Mr. Berhami, Udacity has educated over 15.4 million learners since its founding in 2011. Can you tell us, in what ways do you believe an effective reauthorization of WIOA can help Udacity further expand learning opportunities for even more individuals? And are there reforms to the Higher Education Act, such as allowing Pell Grant recipients to enroll in short-term workforce development programs that would allow you to successfully help more learners?
Thank you, Congressman, for the question. So while we have had good success to the tune of 15 million learners, the reality is that that metric reflects our business around the world. And so we have run programs in a variety of contexts, direct to consumer, working with corporations, at an enterprise level, as well as through the public sector. And that 15 million encompasses all of it. We're in the early days of WIOA at Udacity, and to be honest, I think I can speak for the broader world of short-term credentials. So when we think about reauthorization, going back to my opening statement, certainly there are a lot of reasons to be encouraged by what this potential reauthorization actually signifies. Anything that helps bring more dynamic options and choice to the learners and employers marketplace, we're in support of. If that helps students have a better range of options, and if that helps employers have a more robust talent pipeline, we support it. To your second question around the Higher Education Act, this is an area in which, generally speaking, what we can say is as short-term credentials start to get their moment in the spotlight next to traditional 2-year and 4-year degrees, we think that these programs should be open to accepting more learners from different backgrounds. And if different grant eligibility becomes a topic for discussion, we support that.
Good. Appreciate that. You also mentioned in your testimony that Udacity offers over 60 nano degree programs. Can you describe what that means? What do these programs entail?
Yes, so a nano degree program is effectively a combination of technical learning and hands-on project work. So earlier we spoke about industry partnerships for curriculum development. If you were to enroll in a program to learn the fundamental skills of cloud computing, you would have an expert in cloud computing, potentially someone employed or connected to that industry, who is effectively delivering this content through sort of bite-sized learning modules. And this experience is augmented by a series of support just interventions. We have session leaders who effectively work, not unlike graduate students in a higher ed context, facilitating discussion and lab work and project submissions. We've got tutors and mentorship resources available. We've got community resources because we acknowledge that a lot of our best learning comes from observing our peers. And this also includes, I could go on, but there's career resources, there's an employer platform to help motivate students and remind them that there are interviews waiting on the other end. These two components, the project work and the technical instruction, come together. And over time, what we've done is we've optimized a lot of these interventions in pursuit of the best completion rates, the best career outcomes that we can find.
How many nano degree courses would it take me to get for me to receive a degree, let's say in business?
So a nano degree credential can be done with a single program, and it would be 4 weeks, roughly 4 months, 10 to 15 hours a week is the type of commitment we're looking for.
And for the purposes of this education for my colleagues on this committee, how much would that cost?
So to the learner, we typically have, what we do, especially in the public sector, is we orchestrate funding through different entities in order to effectively grant a full ride. So we position these as scholarships. The reality is there's a wide range of sort of commercial schemes in which we have kind of positioned our programs. On a consumer level, if you were to come in through the website, you would pay $3.99 a month and you would have access until you're complete. And $3.99 a month is sort of like all you can eat.
Well, this is fascinating and revolutionary. Appreciate that feedback. My time has expired. I yield back.
Representative Wow, Pennsylvania, thank you.
Thank you, Madam Chairman. I'd like to direct my question to Ms. Torres. Good morning, Ms. Torres. Thank you for being here. And thank you for the work that you do every day to care for people who are in need of extra help. In my own family, we have experienced the need for direct care to my mother, who in 2014 was diagnosed with brain cancer and came to live in my house using home hospice. And because this came out like a bolt out of the blue, we had no warning that that was going to happen. We hadn't made arrangements, and I had no choice but to hire somebody to come in and take care of my mother while I went to work for a few hours a day. And she was very well cared for in the few months that she had left in her life. And I thank you and all who do this kind of work. It's so important. Unfortunately, we know that the industry is known for its low pay and high turnover rates. The median wage for direct care workers is $12.27 an hour. And during the year 2018, the direct care workforce experienced a turnover rate of 82%. So I guess my question to you is, do you see career advancement as something that you desire? And if so, do you believe that there is any possibility for career advancement for you in your field? Do you have any kind of pathway to jobs with greater responsibilities and higher pay?
Yes. I do believe that I could go forward with my job. I could build. They have opportunities. Through cooperative, we have opportunities to get involved with office work, or through our union if you want to become a nurse. They are opportunities. We just need more funding.
Mm-hmm. And so I assume you've experienced co-workers who have left their job because of the low pay. Is that true?
Yes.
And have you considered doing that? Have you considered looking for other kinds of work because you just weren't making enough money?
No, because I found the love for my job.
Well, thank you for that. How do you believe that you could be affected if you were, what would it mean for your family if you were able to make more money?
That'd be awesome.
How many hours a week do you work?
I work 36 hours a week. I'm a night worker. I do overnights.
Okay.
I used to do a CD pack, but now I do overnights. And
do you receive any kind of benefits in your job? Healthcare?
Yes, I do.
Do you get vacation pay?
Yes. I have PTO. I have 401k. I'm a worker owner to the company. I have life insurance through my union, 1199.
Okay.
Health insurance, which is very important because I have my son on with me. So I do have benefits. And sometimes benefits are better than the pay in certain situations because we need those for when we get sick.
So in your case, you feel that the work that you are doing is satisfying enough that you don't aspire to leave and go into another line of work. I believe that that's what you said. What about the people that you work with? Do you know others who leave the job, which is such an important job, simply because they want a job that pays more?
Yes, because we need raises, we need the money, and not everyone wants to stay on board knowing that they could make more money somewhere else. And it's difficult because even though I love my job, my wages, I live check to check. I do transportation back and forth. I reside in Connecticut and work in New York. So that's also money going back and forth.
Sure.
So it would be great if they pay my bills, like, like everyone else. So if we was to get a raise, it would be awesome for every home health aide. Why? Because they'll find interest in wanting to go out to work. We could recruit more home health aides and give them the benefits that cooperative and our union is offering. So that'd be awesome.
And which union do you belong to?
1199 SEIU.
Okay, thank you so much. I appreciate your testimony and I yield back, Madam Chair.
Thank you so much. Thank you. And now Representative Good of Virginia. Representative Good? You have to unmute, sir. We can't hear you.
There we go. Thank you. Sorry about that. Trying to hit it and it wasn't working for me. Thank you, Madam Chairman, and thank you to all of our witnesses, and appreciate your time with us today. Mr. Berhami, last Congress, the Republican Study Committee proposed the establishment of an E-Verify program that would require all individuals to be confirmed to the Department of Homeland Security before being eligible for federal jobs programs. This would mean that only people who are legal eligible to work in the United States would be able to take advantage of federal jobs programs. Would you recommend that Congress implement this proposal?
So at Udacity, where we've typically focused our energy is on getting people through the system once they are allowed in. We haven't traditionally taken positions on eligibility of that nature.
Well, the question of E-Verify, mandatory E-Verify for the federal workforce is one that my office has been discussing for some time now, and a policy like this would be a simple fix to ensure that American workers are prioritized and the rule of law is followed and upheld. So I certainly continue to strongly urge my colleagues to consider policies that would institute mandatory E-Verify for the federal workforce. But Mr. Berhami, I appreciate your focus on working within the existing framework that we have, instead of adding to an already bloated welfare state like some on this committee would seek to do. Under current law, there are, and this relates to a previous questioner, but there are social welfare benefits that are reduced if a beneficiary increases their income. And the consequence of this can be a difficult trade-off scenario where lower wage workers must choose whether or not to continue receiving welfare benefits as they potentially increase their income. And this can have the effect of disincentivizing work or advancement for many lower wage workers. How would you suggest that be addressed?
That is a good question, Mr. Congressman. And I think, it takes a lot of analysis to understand the benefit cliff and how it is actually changing behavior. People who are entering programs such as ours are making an investment. To the earlier question, this is not necessarily a financial investment. However, the opportunity cost of stretching their lives even thinner, making sacrifices, potentially even taking themselves out of the labor market need to be considered. I think that the important thing is to look at the outcomes of these programs and to understand, as WIOA has stipulated since its enactment 7 years ago, that not only is credential attainment and job placement important, but also we're looking at median salary. We're looking at it, the system looks at it after 6 months and after 12 months because we want to see retention and we want to see effectively a standard of living that has been sustained. In our particular programs, the sort of archetype of a learner who upskills through a Udacity nanodegree program has set themselves up for, in many cases, a much higher standard of living because they are entering high growth pathways in which the supply and demand in the labor market has supported that. So we believe that accountability and transparency into those outcomes, certainly in our world, helps to keep that momentum moving forward.
I agree, and that's what we all aspire to do, is to help people to get to those higher wage situations. In your testimony, Mr. Berhami, you emphasize the importance of creating effective mechanisms that encourage individuals to invest in their own career transformations. What are some ways that you have seen individuals set themselves up for success by creatively developing their long-term skill sets?
That's an excellent question. And I think that there are so many paths to the finish line. But as is probably no secret to anyone in this discussion, they get what they put in. And so people that look for the path of least resistance might succeed, but on balance, generally will not succeed as much as the people who look for ways to augment their learning experience. Earlier, I mentioned career services that we offer. Some of them are mandatory project submissions. Some of them are discretionary. You can choose to have your resume reviewed and you can choose to do the work to polish it up. Ditto your LinkedIn profile. You can hone your interview skills. You can also, there's a variety of free courses that we offer as well as, the marketplace in general. And so that's the best answer is the more you can invest, likely the more you stand to benefit.
Great answer. There's no substitute for hard work or being the CEO of your own career and taking responsibility. So thank you so much for your time, and I yield back, Madam Chairman.
Thank you. Thank you so much. Ms. Miss Macbeth of Georgia, welcome. Welcome back.
Thank you, Madam Chair, and thank you so much for convening this panel today, and thank you to all of our panelists. And everyone, thank you for sharing your testimonies with us. And I know that this is a vitally important topic, and I appreciate the focus of this committee on continuing to serve all of our workers in America. And I know that we've all experienced a time when an aging parent or a disabled family member really needed additional care in the home. I myself, as many of our colleagues have expressed earlier, had the responsibility to care for my ailing mother during the last years of her life, and finding a good, loving care provider was extremely important to our family. And we know that nearly 20 million Americans need assistance with self-care and daily living, and that number just continues to grow as our population ages. This is an issue that touches the lives of almost every American, and when the time comes, we all want to leave our loved ones in the care of a compassionate and very capable individual. And we should treat those caretakers with the same compassion and the same respect that we expect them to treat our loved ones. And despite the essential nature of their work, as we've been expressing, direct care workers face an extremely high turnover rate of about 80%. And these high rates of burnout, low pay, and limited benefits, and a feeling of being just so undervalued are all central to the challenges facing the direct care workforce. However, we know that, there are solutions for these problems. We've been talking about this today. And President Biden and this committee have proposed bold action to address the direct care workforce shortage and ensure that these are good paying, middle class, high quality jobs. So my question is for Representative Fay. One of the elements that you touched on in your testimony is the need to raise the perception of direct care as a viable, meaningful career pathway. Can you talk about proposals that your state is considering to help implement and achieve these goals?
Oh, thank you, Congresswoman, for that question. So I think the number one issue is pay, is wage rates. And so if we sort of set that aside, which is something that our commission did, because I think everyone on the commission, there was a consensus agreement that the pay was not commensurate with the work. And if we value work by the amount of money that we pay people, then we're not doing justice to the value that this work provides to our loved ones, but also to our economy. There's a parallel between the childcare workforce issue and the caregiving workforce issue as well. So I think I'll just stop there with the pay. Yes, that's where I'll stop. Thanks. Sorry.
Okay.
I don't want to take too much time.
Well, thank you so much for that. And Mr. Espinoza, individuals who are receiving consumer-directed care are often responsible for finding and hiring their own direct care workers, as my family and I had to do as well. While this gives these individuals really a great deal of individual choice. We had a large choice of care providers regarding who provides, services for families. And, we had to do the same for my mother. Can you talk about some of those strategies that PHI actually recommends that helps connect people like us, families like us, with workers who can provide those kinds of services?
Yes, absolutely. Thank you for the question, Congresswoman. One of the best strategies I think that we've been seeing in the field are matching service registries or caregiver registries. These are online platforms that help home care consumers and workers find one another. In California, there are 4 centers for independent living that offer a matching service registries, and they include features for consumers and workers. They include the option for workers to record short messages. There are a variety of technological features that make that interaction more possible, and it allows them to connect based on preference, based on their needs, and based on their availability. However, there are only matching service registries in 10 states. Many of them are chronically underfunded and do not embody the best of technological processes. And so certainly the Direct Care Opportunity Act could make a big dent in this issue. It could ensure that all states have matching service registries, or that we find other viable ways to connect consumers and consumer-directed programs to workers.
Well, thank you so much. And Ms. Torres, I just want to say in my last few seconds, thank you so much for everything that you do, the work that you provide and the care that you provide the residents that are depending on you is truly, truly vital. And we just really appreciate everything that you do for this industry. And I yield back.
Thank you, Ms. Macbeth. And now Ms. McLean of Michigan, when she finishes, the gavel will go back to Mr. DeSaulnier, who has returned to the meeting as co-chair. Ms. McLean of Michigan.
Thank you, Madam Chair. Mr. Berhami, thanks, sorry about that. Your work involves upskilling individuals with vital skill sets that leads to promising careers. Some of my colleagues across the aisle often argue that throwing more and more funding on new federal programs is the answer for workforce development. This is simply not true, and actually could detract from existing workforce development efforts that already work. I intend to actually introduce legislation addressing ways to promote awareness and information on these incredible programs and their beneficial role in shaping our next generation's workforce. I believe we need to focus on helping all workers, including those in direct care sectors, by strengthening really existing programs that will further help address the skills gap. Can you speak about the current success and employment outcomes, the actual outcomes that these programs such as Udacity can lead to, as well as any structural changes or reforms that could be better serve both prospective students and actually taxpayers?
Yes, thank you, Congresswoman, for this question. I think that, the way that we look at a successful program is largely within the context of the systems that support it. So WIOA's standard of performance is based on credential attainment. It's based on job placement, retention of that job for 6 and 12 months. It's based on the median salary coming out of that program. So we look at all of these things, but we also use a broader definition of positive career outcomes. We've run programs around the world in which what we've done is measured the impact for a learner coming out of our program, not only on the ability to obtain a job offer, because that may or may not have been their goal. It may or may not have been the goal of the funders and the sponsors of this program. We've run a program in Egypt, for example, where we are working with tens of thousands of graduates to put them in gainful freelancing work. And the attainment of a freelancing gig or a series of them would be a positive career outcome. So would a promotion, either in title or pay or both. So would the launch of a successful venture. It could even simply be that you self-report yourself as being happier on the job. So we look at these positive career outcomes, and they are broadly defined. It gives us a basis on which to optimize our programs and really make sure that this technical curriculum paired with the projects also is supported with the right wraparound services to maximize those outcomes.
Sure, thank you. And then workforce shortages in the healthcare industry have long been an issue, but have only been really exacerbated by this pandemic. As our next generation workforce takes shape, there will likely be advancements in technology and the healthcare industry, which will require obviously a robust workforce. Can you speak to how programs and platforms such as Udacity can help address some of these shortages and the skill sets they can provide for future healthcare and jobs?
Yes, it's a fascinating topic, and we are in the early days at Udacity of looking at sort of sector-specific solutions of this sort. But I'll give you one example. We offer a program for artificial intelligence in healthcare. And this really provides what we see as a very modern skill set, which is a bit of a lead pass for where we see the industry going. Now, you'll recall earlier, I spoke to the 2.3 million open jobs in healthcare, and the very small subset of those today that represent these types of technology sort of related skills. But we do see that changing over time, and that's due to all of the investment in digital transformation. So our AI for Healthcare nano degree will, here's an interesting application, using the data that comes from wearable devices to understand the context around some of these indicators, something as simple as your heart rate, your pulse, right? If we understand the context, we understand the altitude, or the accelerometer tells us that this person was actually moving quickly, right? This can now add important metadata for a practitioner to understand. I can rule out explanations A, B, and C and focus my diagnosis on X, Y, and Z. So we hope to use that technology in a productive way.
Thank you, sir, and thank you for all the guests today. I yield back my time. Thank you.
Thank you, Representative. Thank you, Chairwoman Wilson. Wonderful to partner with you. And now I'd like to recognize the distinguished gentlelady from Michigan, Representative Stevens, for 5 minutes.
Well, thank you, Mr. Chair, and thank you to our witnesses for today's very important hearing on caring for our communities and supporting and investing in the direct care workforce. Let me just couch this in the Michigan sense really quickly. Michigan has about 60,000 direct care workers who take care of our elderly peoples and peoples with disabilities in their own homes. In addition to our current shortage of direct care workers, state officials estimate that Michigan is going to need an additional 178,000 direct care workers in the next 10 years to meet growing demand. That's more than twice the current workforce. Currently, there are not any federal or Michigan state training initiatives or certification requirements to work as a direct care worker in someone's home. We all know, and we've talked about today, the pay being low, the benefits being virtually non-existent. And over time, it's becoming more and more common that the work is obviously grows to be physically and emotionally demanding. Michigan home care workers are paid somewhere between $9.50 and $12 an hour without a lot of benefits. So, Mr. Espinoza, you had mentioned in your testimony that the COVID-19 pandemic worsened existing challenges for the direct care workforce. Could you just talk a little bit more about that specifically and the impacts that the pandemic had on our home care workforce and the people they support?
Yes, thank you for that question, Congresswoman. What we saw in our experience and through our research was that in the early stages of the pandemic, direct care workers were on the front line, but they were often there without enough PPE, without enough supplies, without childcare or paid sick days, and without proper compensation. In fact, we heard some horror stories in New York City, for example, where PHI's headquarters are based, of workers using garbage bags as gowns and purchasing their own protective equipment. And many workers were being asked to make the impossible choice. Do I go to work and risk getting infected or infecting my families and clients without paid sick days? Or do I stay home and collapse financially? And employers and industry groups also sounded the alarm. Our research would show that about 280,000 workers left the direct care sector in the first 3 months. Now, that said, over time, we have seen that these numbers have begun to settle and return back to normal. But there are still a variety of questions that I think the direct care workforce in the long-term care sector needs to address, really to strengthen jobs and to protect ourselves during the next healthcare crisis. What has been the mental health impact, for example, on workers who saw clients and family members die? How does this affect turnover? What does it mean that this sector often lacks grief support and bereavement leave for workers? How should this sector improve safety standards, infection control and prevention, emergency preparedness? How do we recruit effectively when so many workers saw how dangerous and unprotected these jobs are, especially in nursing homes? And how do we learn from the short-term measures that were adopted, from hazard pay to paid leave to childcare centers in certain cities or virtual trainings, to think long-term, to modernize the job and to transform this sector in the long term? I mean, certainly we would ask for a federal report on the lessons learned of this workforce and how to prepare for ourselves in the future.
Great. Thank you so much for that really, really thorough explanation and just all of your background. With my remaining time, Representative Fay, in your testimony, you talk about individuals who are eligible for home care and community-based services going unstaffed because there is simply a shortage of workers to provide the services that the individual is eligible for. Could you just tell us what's at stake when an individual is not able to access the care they need?
In some circumstances, people will die because they can't access care. And that's part of what really keeps me doing this work. You know, making sure that there's a workforce there to care for folks that need it so that they can live their best lives is I feel like one of the most important things that I can do as a representative. So not being able to do the things that bring people joy or simply live with dignity is what's at stake here.
Thank you for that. And with that, Mr. Chairman, I yield back.
Thank you, Ms. Stevens. I'm back. This hearing is impacting each and every one of us personally. And it has really just impacted our constituents. This is very moving. And now we'll hear from Mr. Harsberger of Tennessee.
Thank you, Madam Chairman. My question is for Mr. Berhami. I've been in the healthcare industry for 35 years, and I have absolutely serviced and worked right alongside with these direct healthcare workers as a pharmacist in making sure that we work with home health and hospice, the agencies, as well as the healthcare providers in that. And I absolutely know there is a shortage of direct healthcare workers. You know, there's a shortage of registered nursing, especially in rural communities. And from Representative Fay's comment and what they saw from some research that this is a dead-end job, I absolutely agree with the chairman that that's a marketing failure, in my opinion, because this is just a springboard to so many other areas in healthcare as far as the nursing industry goes. And from the business component, more money does not equal better outcomes. And I could tell you that from my profession and being a business owner too. I looked at your testimony though, and there's so many things that you recommend for the We at Work program as far as structural changes. And just like you create a more scalable registry of providers, every state is different. Make that easy for them to, compile that information. I'm looking at the facilitating the mobility of dollars across labor markets. I'm a border state right at the tip of Virginia. So a lot of those people that may live in Virginia work in Tennessee or vice versa. That's a huge problem. Increase the accessibility and transparency for all programs. Make a single source where they can record that data. That's a no-brainer as well. You've got a ton of good recommendations in here. Incentivizing community colleges to work with employers. We have community colleges in my district that do CNA programs or LPN programs. We have workforce development agencies who do the same. We have a hospital system who will train at no charge, do the CNA program to where they can go get certified. Some of the things you talk here about fostering a more dynamic relationship between workforce board and learners, about the marketing operations. People don't know what they don't know, and marketing is a huge part of that. And in your industry, with all the AI and things you have, this should incentivize people to come look at this. But what I want you to talk about is to incentivize distribution of funding toward distressed communities. I have 2 distressed counties in my district. And like I said, people don't know what they don't know. How do you get the word out to those people that there are opportunities out there? And how do we do that? How do we bring them into the fold and keep them there by giving them that opportunity, sir?
Thank you, Congresswoman. I appreciate the feedback, and I appreciate your taking time to think through all that goes into these reforms. So when we consider this critical point of view around facilitating a relationship between workforce and the general public, you've hit on exactly the problem. What do they know about the system that's designed to serve them? The workforce board of any given county or metropolitan region or state is not a consumer brand. The closest thing to a consumer brand is the job center, which has a retail presence and is where you go to get coaching and to look at the job board and maybe attend a career fair. But what we need to do is, and I use this word modernize a lot today, we need to sort of 10x the sophistication of the relationship between the server and the recipient of that service. So understanding the range of programs, understanding the range of conditions or status quo that these programs are designed to serve. And to your point about distressed communities, structuring programs in such a way that we provide the supports. I'll give you a very simple example. Our programs don't work if you don't have a laptop and a broadband connection. Now, penetration of broadband is quite high at an aggregated level, but when you go into distressed communities, those numbers plunge. So that requires us to broker those partnerships on the side. Sometimes we'll work with community partners. Sometimes the workforce board can nominate someone, or we've got to do the work to find those connections to get people to donate laptops. And so I know there are always good ideas in the mix for how to make these provisions for distressed communities, but it needs to be more endemic to the workforce system versus a box that we check and something we pursue separately.
We will continue our conversation, sir, and great ideas, and I yield back.
Thank you so much. And now, Mr. Levin of Michigan.
All right. Thank you so much, Chairwoman Wilson, and also to Chairman DeSaulnier for putting together this vital hearing on the direct care workforce. You know, direct care professionals do the challenging work of taking care of the most vulnerable populations in our country, our young, our old, our folks who are sick. And as our nation ages over the coming decades, this direct care work will become ever more essential. As a result, we'll need more direct care professionals. But if you look at the obstacles they face, it's no wonder that we see such high turnover in this field. Direct care workers must contend with low pay, a lack of resources, lack of benefits, lower job agency, and inadequate training options. And it's not due to marketing of workforce agencies. In Michigan, actually, our workforce investment boards are very strongly branded as Michigan Works, and the public knows about them. But these are just not jobs that enough people are able or willing to do because they're so low paid and they have so low status in society, which is all of our fault. It's the fault of policy. So we've got to invest more in direct care to ensure that direct care workers are valued and have the resources and respect fitting this essential, complicated, and dangerous work that they do. Mr. Espinoza, you mentioned in your testimony that in all 50 states and DC, the direct care worker median wage is lower than the median wage for other occupations with similar entry-level requirements, due in large part to the limited funds available through Medicaid. So as you know, the American Rescue Plan increased federal funding for home and community-based services by 10%. Can you talk about how these funds have enabled states or will enable states to improve wages for these workers? Will the money really get through to the workers?
Thank you, Congressman. I think the American Rescue Plan can make a big difference in improving jobs and improving supports for people who need this level of support. What it does specifically is it increases the federal matching rate by 10 percentage points, and it encourages states to use that additional funding to both expand home and community-based services, but also in many instances improve jobs. Several states have put forth their spending plans, and we have seen a number of measures in those plans that would do a great deal for workers in those states. So for example, North Carolina recently introduced its spending plan, and some of its measures include $210 million a year for recruiting, retaining, and building the network of HCBS direct care workers, also money for employment training for direct care workers, and money for a direct care workforce survey to better understand what are the driving factors for so many workers to come into the sector or leave the sector. And this would, of course, not just address marketing, but it would address how do you transform the overall quality of the job. New York has also put forth its spending proposal, and it includes about $2.1 million for direct care workforce issues, including the long-term care workforce in value-based payment readiness, improving jobs for direct support professionals, which are a segment of the workforce that supports people with intellectual and developmental disabilities, but also issues like transportation, Medicaid rehabilitation rates, training and supports, and building evidence-based practices, and more. So it shows, I think, both the possibilities that increased Medicaid funding can have on improving jobs and improving services, but also the incredible need that's needed in this sector in every state to strengthen recruitment and retention.
Does PHI have specific recommendations regarding increasing federal Medicaid funding on a going forward basis after, after what we've already done?
Yes, absolutely. I mean, we would argue for many of the items that I mentioned just right now, but we would include, how do you improve wages for direct care workers? How do you strengthen the training infrastructure for employers, including virtual, but also in-person and hybrid approaches? How do you create career advancement opportunities? Can this money be used to strengthen the data collection infrastructure so that employers and policymakers can better track workforce capacity and job quality? And how do you improve research and surveys on these workers? Those are a handful of recommendations that we would issue. Yeah.
Well, thanks. Madam Chairwoman, I started working with healthcare workers who wanted to organize in the early 80s. And I have, throughout all these decades, this workforce has never really been changed in terms of being paid adequately, having real career tracks, real opportunities for advancement, and the training and supports they need. It's high time we get that done. They need it, and the people they care for need it. And with that, I yield back.
Thank you, Representative Levin. I agree with you 100%. It is our responsibility to change that scenario.
Yes, ma'am.
Representative Fitzgerald, and then after Representative Fitzgerald is recognized and speaks, I'll pass the gavel back over to our co-chair, Mr. DeSagne. Daryl, you're on mute.
No, Madam Chair, I'm here. Are you ready?
Ready.
Okay, thank you. Mr. Berhami, in Wisconsin over the last, in obviously unique circumstances where a lot of these caretakers and the workers that are doing this very difficult job, their challenges have been increased significantly. We're still working on the steady pipeline of individuals that are willing to take this type of work on in the direct care space. In those discussions, I mean, is there any relationship that you feel is being developed? And I would say probably more of in the traditional educational institutions like tech colleges, or there's some instances I would think in which hospitals or clinics would provide OJT for some of these individuals. That would be kind of the first question I would have.
So I want to make sure I understood your question, Congressman. So we're asking, do we see entities in this ecosystem, the industry and the training providers actually moving closer together and working more closely in partnership?
That's right. Yeah.
So I think that it's yes, in broadly speaking, absolutely. I think that there's a lot of evidence of it. On one extreme, you've got tech companies that are actually launching their own quote unquote universities, their own upskilling programs, because the adoption of their products and services in many ways is bottlenecked by skill shortage. No surprise there. That goes back to the narrative we've been talking about all day long. But I think that there's another aspect of this, which is it's what the system is demanding. We have I think an increasing the reality and the mandate for these educational providers of all stripes is to show these outcomes. I've been beating a dead horse today with that word outcomes, but the reality is, if you zoom out and you think about the student debt crisis, right? At the end of 2020, the first wave of graduates who came out during the pandemic, the joblessness rate of those graduates was 3.5 times what it was the year prior. So when you look at the average amount of debt, about $36,000, 45 million Americans having that debt, you're measuring the impact to American GDP in the trillions. And it's literally becoming a bigger part of that pie. So I do think that organically, just basic supply and demand is pushing us in that direction.
Very good. And let me just follow up with, so if there is a reauthorization of WIOA, is there one thing that really, and I know you probably touched on this numerous times today, but is there one thing that really stands out that we should maybe make adjustments to or make changes to that could actually, help us in determining whether or not the full reauthorization is warranted, or is there something that should be tweaked, I guess?
It's an excellent question. In preparation for today, I narrowed it down to about 15 for the purposes of brevity. I think that, if we had to narrow it down to one, I would say we need to have a free flow of ideas and a free flow of awareness for all stakeholders in this ecosystem. What is it we are trying to do, and how do we make the most of the system that we have? And that means learners of all archetypes. It means educational institutions of all, traditional, non-traditional, long-term, short-term. It means employers representing all industries. There would need to be some sort of a forum or some sort of a sort of consistent vehicle for all needs to be put out in the open, for us to then realize that actually we're all more or less going for the same thing.
Got it. Very good. Very good. Thank you very much. Madam Chair, I would yield back.
Thank you, Mr. Fitzgerald. We'll now recognize Mr. Bowman for 5 minutes.
Thank you, Mr. Chairman. Mr. Espinoza, thank you for all the work you do at PHI in the Bronx. As you know, part of my district includes the Bronx and is home to many caregivers. As we emerge from the pandemic, we have a historic opportunity to build an America that works for all people by centering the care that all people need. So often, the very people who provide critical caregiving work in our communities are not able to care for their own loved ones, like an ill family member or a young child. Earlier this year, I introduced my Care for All agenda resolution because we need to dramatically expand and strengthen the care economy and improve conditions and compensations for care workers nationwide. In addition to better wages, can you talk about specific conditions such as pathways to unionizing and free or low-cost childcare for care workers that we need to consider in the face of rising demand for care work?
Yes, thank you for the question, Congressman. There are a variety of strategies that are needed to really strengthen the direct care workforce and ensure supports for the people they support. As you mentioned, I think unionizing, collective bargaining has been used as a strategy in many states to elevate wages, to provide benefits and a wide range of employment supports, to provide career advancement opportunities, and to create a collective voice that can advocate for change on the job and in their sector. We've also seen in New York, we're affiliated with Cooperative Home Care Associates, and Zoma is speaking here from CHCA, opportunities for worker-owned cooperatives. There are other ways in which workers can have a voice in defining the quality of a job and ensuring that those supports are as strong as possible. When you look at the research on direct care workers, what you see is these incredible challenges. I mean, certainly we often point to poverty level wages, which forces about 45% of direct care workers into in or near poverty. But because of that poverty, so many workers then rely on public assistance to survive. And in many instances, it's low wage jobs and the ability to access higher paying jobs in fast food or retail in most states that are driving these workers out of the sector and are destabilizing the workforce. So as we think about strategies to strengthen this sector, certainly any of the interventions that the Direct Care Opportunity Act support, from training to advancement opportunities, to recruitment and retention innovation, to technology and other kinds of supports, are critically needed, but so is the evidence base. How do we make sure that the federal government is investing in those interventions that are most effective, that improve employment, that improve care, and that improve cost savings? So I think this is a critical opportunity for this country.
Thank you, Mr. Espinoza. PHI has a powerful resource that shows in New York, 57% of home care workers are accessing some form of public assistance, which is a clear demonstration of underinvestment. President Biden's American Jobs and Family Plan. President Biden's American Jobs and Families Plan would make a significant investment in Medicaid's home and community-based services, which is a necessary step in the right direction. In addition to funding, what do you think needs to change about the way we talk and think about care work? How can that translate to federal policy?
Yeah, thank you for the question, Congressman. I think there are a number of representations about direct care workers that are inaccurate. One of them is that it's unskilled or low-skilled labor, when in fact, what we know through our work and what many people in this field know is that direct care requires a range of skills and knowledge. The National Academy of Medicine encourages that direct care training include at least 75 hours of training, which acknowledges the level of skill, knowledge, and confidence that these workers need to succeed in these roles. Another representation is that these workers aren't dealing with life challenges or job-related challenges that are threatening their stability on the job. And yet what we know and what employers can show is that there are a wide range of challenges that they're facing both in their jobs and in their communities. In their job, it includes everything from safety and workforce violence. It includes a lack of training, a lack of career advancement opportunities, often challenging situations with consumers, but also family members. And in general, a lack of recognition and respect for the critical role that they play. And for many of these workers who are women, people of color, and immigrants, they are facing challenges in their communities that make it that much harder to succeed on the role. So I do think that challenging those misconceptions and valuing workers for the critical role they play by funding something like the Direct Care Opportunity Act would do a great service for these workers and all of us who need this level of support.
Thank you so much, Mr. Chairman. I yield back.
Thank you, Mr. Bowman. I will now recognize Representative Letlow for 5 minutes.
To all the witnesses, thank you for taking the time to testify before the committee today. After the past year we've had, it's clear just how important it is for our country to have qualified, trained professionals in the healthcare sectors. Our doctors, nurses, and healthcare workers across all fields are vital in providing essential services and helping patients and families through some of their most difficult times. While I understand the motive is good, I have serious hesitations with authorizing another massive new grant program for $1.5 billion to address only one sector of the healthcare field. I believe we should be utilizing existing funding streams under the Workforce Innovation and Opportunity Act and the Registered Apprenticeship System to prioritize high-demand fields such as direct care workers. Additionally, having employers more involved in workforce education curriculum will help future employees come out of school prepared to handle the latest challenges and trends and ready to enter the workforce. My question is for Mr. Berhami. In your testimony, you emphasized the importance of facilitating the mobility of dollars across labor markets and incentives to collaborate with neighboring workforce areas. What specific reforms should be made to promote greater coordination across communities? And what benefits are there to incentivizing collaboration?
Thank you, Congresswoman, for the question. I think this is important. Let's just consider a hypothetical case study. You're in a specific county, you live there and are a contributing member of that society, and you happen to be interested in upskilling yourself. It could be that most of the career opportunities happen to be in the next county over. And as a resident of one county, with employers buying into a program that is headquartered for all intents and purposes in another county, we encounter difficulties where that money does not flow freely unless there are partnerships established within those two distinct workforce areas. Now, there is nothing holding back those workforce areas from collaborating, but that takes time and attention and energy and resource, and that is immediately creating drag on the process. So there needs to be, it starts with a fundamental understanding of how the labor markets in this economy have evolved over time. There is more breadth. Look at commute times. That is a perfect example of how geography has changed this dialogue. But also consider the rise of remote work. What we need to do is make provisions for these circumstances and create abilities either with a sort of a parallel hierarchy in which that particular type of partnership is facilitated, or some other workaround, some other carve out that allows me in county number 1, the ability to go with confidence and try to get involved in a workforce program that might not be in my backyard.
Thank you so much. I appreciate it. I yield back my time.
Thank you. We will now recognize the representative from New Mexico, Representative Fernandez.
I want to thank both chairs and ranking members, and I want to thank the witnesses for their excellent description about how important this care is to each of our families, to each of our communities, to our country as a whole, how difficult the work is. I really did appreciate Ms. Torres's description of the number of hours she works, how heavy the work is, how hard the work is, but also how much care she puts in that work. It truly came through. And so for your testimony, I'm extremely grateful, Ms. Torres. I want to address my questions to 2 types of direct care workers, those working in rural communities and those who are immigrants. I represent the 3rd District of New Mexico, a beautiful district, but it is the size of Pennsylvania. It's beautiful, it's got wide open landscapes and lots of small rural communities. Some in the sense that we were listening to Mr. Berhami talk about, it's like multiple counties. Representative Fay, you represent Maine, a state that's also very rural. Can you describe the specific challenges direct care workers face in rural communities? And ways, maybe I'll combine it, ways in which Congress can incentivize individuals to work in those rural communities?
Oh, that's a fantastic question. So in our commission hearings, we heard from rural direct care workers, and one of the primary barriers for them was travel time. So they're not reimbursed, home care workers are not reimbursed for their travel time. And if you're working in Penobscot County or Piscataquis County, it might take you an hour to get to your client, and then an hour back. If you have more than one client, then you're doing an awful lot of travel. So I think we can think of other things, broadband access. So we have electronic visit verification now, which is required. In some of those places, there's no internet access. You're required to have some sort of electronic device, and that can be a challenge, and providers don't have necessarily the funding available to them to pay for those devices. So I think we could play that out in many different ways, but those are 2 of the most significant barriers that we discussed.
Thank you very much. And I think that this testimony also highlights to us that in Congress, we must address all of these complex issues, recognizing the interconnectedness so that we work on broadband at the same time that we work on properly valuing our home care workers and our direct care workers. Mr. Espinosa, New Mexico's got a long history, culture, and economy based in valuing our immigrant workers. Although New Mexico, the border changed on us, we've always welcomed and honored our immigrant workers. You mentioned in your written testimony that 27% of the direct care workforce are immigrants. And I know there's been discussion about the disparities immigrant direct care workers face compared to their colleagues. In another place where there's this interconnection, could you describe how offering undocumented immigrants a path to citizenship might help stabilize the workforce and eliminate disparities? Is that something you can speak to?
Yes, absolutely. Thank you for the question, Congresswoman. Just as background, our research shows that about 1 in 4 direct care workers is an immigrant, and that totals about 1.2 million immigrants. It's also, well, our research also shows that that segment of the workforce, immigrants in direct care, is growing faster than US-born workers. So it's a part of the future of this sector. Our research doesn't capture undocumented workers, and it doesn't capture workers who are hired in the gray market. But certainly we can assume that being an undocumented worker who's working in home care most likely runs a variety of challenges, right? They often fear retaliation from their employers. They often struggle with the challenges of navigating an immigration system and the rise of anti-immigrant hostility. And a pathway to citizenship in particular would stabilize the job for those workers, but it would as importantly, stabilize the workforce for consumers who need those workers, right? Especially recognizing that immigrants are a big part of the future.
Thank you for that. I would note that if we actually did the American Citizenship Act, it would provide a $1.4 trillion benefit to our economy, as well as provide the workers in this industry we need. My time has expired. I yield back.
Thank you, Representative. Next would be Representative Spartz, if she is interested in speaking. I don't see her. She was on. Give her a second. If not, we'll go to Representative Sherrill. Representative Sherrill, you are recognized.
Thank you so much, and it's great to be here. Representative Fay, your state and nation have been struggling for years to develop a strong pipeline of direct care workers to meet the needs of our residents. You've said the shortage of direct care workers has become a real crisis in your state. Can you say more about why this is a crisis and what have the impacts been on older and disabled residents based on this?
I think the crisis was laid bare by the pandemic for reasons that we have talked about a little bit today. There are some problems for workers going into folks' homes. I'll say specifically, in Maine, there are some personal care attendants who are not characterized as healthcare workers, and they didn't, for instance, early on have access to vaccines. So that was problematic for them and problematic for their clients and the people that they care for, because if you rely on someone else to help you cook meals, then your nutrition suffers. If you require someone else to help you get to doctor's appointments, then your health suffers. And we also know that isolation has a significant impact on mental health. So I think those are some specific impacts that we saw of the growing crisis in the workforce shortage. And that continues. We have a workforce crisis across the state in most sectors. So we are now having the challenge of having to try to attract workers into this particular low wage work. And then for reasons which I mentioned before, the healthcare impact to their clients is really negative.
So is any of what you're discussing a funding need directed towards job training and recruitment of direct care workers, or it sounds as if it's not necessarily on the training end, that it's just that the actual payment, the low payment? I'm just wondering if this is a recruitment and training problem, or if it's simply wages need to be higher in this industry.
It's both. I think necessary to increase wages, but not sufficient. One of the things I mentioned in my testimony is the way we value the work. And if we're having folks whose work isn't valued, caring for people who maybe are have a less of a voice, who are less visible, people with disabilities and older folks, then we have a system that's sort of a negative feedback loop. So we need to raise the wages, but we also need to raise the visibility and the way that we value these jobs.
So given this, what would the effect of the American Jobs Plan's $100 billion investment in workforce development on the long-term ability of the home care industry to recruit the level of staff it needs? What would that impact be?
I think the impact would be significant. In Maine, much of the work is funded, much of our direct care needs are funded through Maine Care, which is our Medicaid. And while the state matches, that's a significant impact on our state budget. And having ongoing funding and the ongoing ability to do workforce development through additional funding coming into the state would just be huge.
Well, thank you so much. I really appreciate your testimony today. Thanks, Mr. Chairman. I yield back.
Thank you, Representative. I've got Representative Mervin next. I don't see him on the camera, but if you're ready to go, please proceed.
Mr. Esposito, in your testimony, you note the astronomical turnover rate among home care workers of 65%. Can you tell us more about the impact of the high turnover on the continuity and quality of care, and also outcomes for older people and people with disabilities who rely on long-term services and supports?
Yes, thank you for the question, Congressman. As I mentioned earlier, turnover is one of the top threats that providers specifically name facing their agencies. They name caregiver shortages and caregiver turnover. And two recent studies did show that the turnover rate for nursing staff and home care workers are about 99% and 65% respectively. And it often happens within the first 90 days. Turnover has a huge impact on everyone in the system. It creates job instability and financial challenges for workers who must move from one job to another. It disrupts continuity of care for consumers. And oftentimes a worker will have quite a bit of valuable information on someone's health, someone's preferences, someone's experiences. And a lot of that can get lost when a worker turns over to another worker. And it affects employers. The estimated direct cost of replacing a nursing assistant or home care worker is about $2,200. And that affects employers and it affects the system. There are ways in which interventions can dramatically address turnover and retention. We launched an initiative in 2013 that provided a 120-hour adult learner-centered home health aide training curriculum with about 500 trainees in New York City. And it led to a variety of improvements. And most importantly, in addition to the ways in which it improved patient-centered care or cultural competence, we found that 90% of participants completed the course and that trainees were more than twice as likely to be on the job at 3 months and 64% more likely to be on the job at 6 months. So there are ways in which workforce interventions, if well-designed and evaluated, in different parts of the country to allow for that local context, can make a big dent in addressing turnover and retention.
You're muted, Congressman.
I just wanted to give a quick narrative. I was able to join a symposium where it was long-term workers, and there was a family who had a individual who was disabled and a daughter. And ultimately, the continuity of care was their most important aspect of what was going on in their life. And the continuity of care actually did play a role in the quality of care and the outcomes. With that, I was just going to ask Ms. Torres if you could briefly just touch base on the value of continuity of care as you do this job.
There's a question again?
I was just, if you would touch base on the continuity of care, how valuable it is to have a long-term employee with someone who needs long-term care.
Absolutely important. It's really important because they need us. They need us. Some of them don't even have family members. And without us, they can't take their medication, take a shower, have something to eat. So we're so important to them and they need us that much. So it's absolutely important to me to be there.
Well, I thank you for what you do. And again, I yield back my time and thank you both for your answers.
Thank you, Representative. Chair will now recognize Representative Castro for 5 minutes.
Thank you, Chairman. Immigrants make up over a quarter of the direct care workforce, yet are largely unprotected and provide essential support for so many Americans. And this is why I introduced the Citizenship for Essential Workers Act to ensure that these workers who are risking their lives during COVID are now provided the protection that they deserve. We must ensure protections and support for our care workers, and we cannot overlook them any longer. And so I had a question for Mr. Espinosa. Can you talk about the importance of immigrant direct care workers in the healthcare workforce and what challenges they face in this workforce, such as isolation and the risk of contracting COVID-19?
Yes, absolutely. Thank you, Congressman. I mentioned earlier that about 1 in 4 direct care workers is an immigrant, and we can assume that immigrants are also a big part of the gray market, where many consumers out of financial need hire workers out of sort of off the book, so to speak, and create those employment arrangements. Our research shows that they're a vibrant part and a growing part of this sector. They come from 124 countries. They speak 157 languages. And yet we know that we're at a time in our country where anti-immigrant hostility is on the rise, and many workers feel unstable, not just in their jobs, but in their communities. So all of the challenges that all direct care workers face, like inadequate compensation, limited training and advancement opportunities, a lack of workplace benefits or general recognition and support, immigrants face as well, but they face it within a heightened context because so often the instability they're facing doesn't end at the job. It continues on in their lives, in their homes, and in their communities. I do think there are a wide range of interventions that could be used to bolster supports for immigrants in this sector. Certainly, we would advocate for pipeline approaches that would bring more immigrants or foreign-born workers into this sector. We would also argue for interventions that support immigrants who are already here and working in direct care. In New Mexico, an organization called Encuentro developed a really amazing home care training program that it delivers in Spanish and English for immigrants in home care, and it prepares them and employs them once they undergo the training, but it also helps them navigate life challenges and employment challenges. So I do think as our country becomes more diverse, that there are great opportunities for innovators in the field to think about how do we capitalize on a rich and diverse country? How do we draw on the strengths that immigrants bring to this sector?
Sure, and you touched upon some of the things that as a Congress, as an American government, we can do to support them. I wanted to ask you specifically about a few more things. First, with respect to workforce training, what can we do to provide better workforce training for this group of folks, and also support that's available in their language and in their communities as well?
Thank you for the question, Congressman. In general, to improve training for these workers, we need a few strategies. One is we need to strengthen training requirements for all direct care workers, but especially personal care aides, which are a growing, probably the largest segment of the direct care workforce, yet there is no federal requirement and no state goes past 40 hours a week of training, right? So 40 hours of training total for entry-level workers. So we certainly need to strengthen training requirements. We need to standardize training and make them portable and stackable so that workers can work across occupations, but also they can work across settings and across states. Too often workers need to be retrained again when they move jobs or when they move states, for example, right? And we certainly need training that is culturally and linguistically competent, recognizing that so many workers are people of color and women and might benefit from training that is more appropriate for the kinds of challenges or learning styles that they have. There are opportunities, I think, in the Direct Care Opportunity Act to test and bring to scale those kinds of training interventions so that we can make sure that all workers have the knowledge and the skills and confidence to succeed in the jobs. And we need more research specifically on the gray market. What does that sector look like? What are the experiences of workers, specifically immigrants, in that sector? And what are the experiences of consumers who, out of financial need, are turning to the gray market? And that's another place where I think federal leadership can really make a dent in this workforce.
Well, thank you very much for those responses. And I yield back, Chairman.
Thank you, Mr. Castro. I don't see anyone else. If there's anyone else, any members who would like to speak, now is the time. If not, I'm going to go to a little housekeeping work before we go to closing comments. And again, thank you to all the witnesses for being here. Really great testimony, very helpful. So with that, I want to remind my colleagues that pursuant to committee practice, materials for submission for the hearing record must be submitted to the committee clerk within 14 working days following the last day of the hearing. So by close of business on August 3rd, preferably in Microsoft Word format. The material submitted must address the subject matter of the hearing. Only a member of the joint subcommittees or an invited witness may submit materials for inclusion in the hearing record. Documents are limited to 50 pages each. Documents longer than 50 pages will be incorporated into the record via an internet link that you must provide to the committee clerk within the required time frame. But please recognize that in the future that link may no longer work. Pursuant to House rules and regulations, items for the record should be submitted to the clerk electronically by emailing submissions to edandlabor.hearings@mail.house.gov. Witness questions for the hearing record. Just want to mention again, I want to thank the witnesses for their terrific participation today and your obvious interest and passion for the subject matter and expertise. Members of the joint subcommittee may have some additional questions for you, and we ask that the witnesses to please respond to those questions in writing. The hearing record will be held open for 14 days in order to receive those responses. Again, I want to remind my colleagues that pursuant to committee practice, witness questions for the record must be submitted to the majority committee staff or committee clerk within 7 days. The questions submitted must address the subject matter of the hearing. Now we'll go to closing statements, and I want to recognize the distinguished ranking member of the Higher Education Workforce Investment Subcommittee, Dr. Murphy, for a closing statement. Dr. Murphy.
Mr. Murphy.
Thank you, Mr. Chairman. I understand the difficult work. I want to thank all the committee members and the witnesses. I appreciate your counsel and a lot of good discussions today. I understand the difficult work environment that direct care workers can find themselves in because I've worked alongside them, as I've said previously, as a physician for over 30 years. Their contributions are meaningful. They make a difference in so many, many lives, especially towards the end of life. We're going to rely on these important individuals as our populations grow and as our population ages. Our witnesses did a wonderful job today illuminating some of the challenges that these and other healthcare workers face. I look forward to working with my colleagues on both sides of the aisle to consider how public policy can foster an environment where more people will consider the healthcare workforce as a valuable and rewarding career path. The best way to do this is to strengthen WIOA. Healthcare occupations must be examined within the context of all professions to make sure that job seekers are fully informed. WIOA can help direct care workers gain the skills that they need to succeed in the long term, no matter which career path they can pursue. Thanks again to all the witnesses. This was a very good committee meeting. Thank you, Mr. Chairman. I yield back.
Thank you, Representative Murphy. Appreciate your comments. And now I'd like to recognize my co-chair and thank her again for being able to step in for me. I had a couple other hearings going on at the same time, and one of them requires a little nimbleness, the Oversight Committee. So Chair Wilson, thanks again, and happy to have you have any closing comments.
Thank you, Representative DeSagne. I want to thank our amazing witnesses for sharing their in-depth expertise and moving experiences. This has been a very insightful hearing. There are people in our country doing God's work. Thanks to all of the direct care employees in the nation who help our families and our constituents every single day. We appreciate you. As we all heard throughout our discussions, direct care is physically and emotionally taxing work. It is hard. Yet, while the demand for direct care services is surging, workers today aren't earning living wages or even receiving the necessary training to safely do their jobs. They need our help, and it is our responsibility to help them. People are living longer and desire to live in their own homes. That is why we need to secure significant resources for direct workers by passing the Americans Jobs Plan and the Direct Care Opportunity Act. These proposals would take significant steps towards recruiting and reinforcing the direct care workforce pipeline, and they would help create millions of good paying jobs as our economy recovers from the pandemic. Most importantly, investing in our direct care workers would increase our capacity to help aging Americans and individuals with disabilities live with independence. We have to pay these employees what they are worth. As a matter of fact, their job description is priceless. I'm grateful for our discussions today, and I yield to the ranking member, and I yield to the ranking member for his closing statement.
We'll go to the good son, Mr. Allen.
All right, thank you. It's great to be with you today, and I thank the witnesses for their helpful testimony. COVID-19 brought attention to the immense sacrifices frontline workers make every day. They deserve our recognition and thanks. In fact, all of our medical professionals do. As Republican leader of the subcommittee tasked with developing healthcare and labor policies, I am particularly interested in supporting individuals who may be interested in entering the direct care workforce. In my mind, Congress must clear the way for state and local workforce boards to leverage private sector innovations occurring in their communities. Mr. Berhami's testimony shows us how critical it is to set folks up for long-term success. Creating additional single interest government programs is short-sighted. Our committee can do better than spending additional taxpayer dollars on short-term Band-Aids. We need to heal the root cause of our problem. As this committee considers a bipartisan reauthorization of WIOA, we must consider how we can address all workforce challenges facing our nation, and they are many. Thank you, Mr. Chairman, for the hearing today, and I yield back.
Thank you, Mr. Allen. It's always a pleasure. I would now like to recognize myself for the purpose of making a closing statement. Again, thank you all of the witnesses for participating. Really terrific. Ms. Torres, thank you. Always most important to hear from the people actually providing the services, not to diminish the contributions of the other witnesses as well. And to the ranking members and Chair Wilson, thank you so much. Certainly, I think if we can't agree on helping seniors, our moms and dads, our uncles and aunts, gosh, I don't know what we could agree with. And knowing and respecting that there'll be some challenges with that, I do want to mention Ranking Member Murphy's comments about being good stewards of taxpayers' funding. I completely agree. One of the interesting things that we talked about a little bit is just the effective and efficient role for the federal government and our partners at the state and local level in being client-based. on their needs and listening to them and the workers like Ms. Torres. So that's a real challenge. And I really appreciate all of the comments from the witnesses. You clearly see this in delivering these services in a very different social model. I always think of growing up in a rural community in New England, not far from Representative Fay in Massachusetts, that was changing into a suburban community outside of Boston, where all of my uncles and aunts and my grandparents were all within 15, 20 minutes, and we all shared. It was a really remarkable bond, but that time, for better or worse, is not the world we live in now. So you all know that, and how we adapt to that is so important. And then lastly, just the urgency I feel, having been in this field for a while at the state, local, and now federal level. People are suffering now, and indeed people are losing their lives that could be extended, and the quality of life could be extended if we acted with urgency collectively. And I think of my own mom, and I really appreciate all the comments from members about their personal experiences as well as their professional, but the issues around transfer trauma as she moved out of independence, but also the trauma of workers coming in and having to establish a relationship in a new environment when they came into her home. So all of these things, I think there's a real opportunity for us to work together to really improve the system. And I would say when we look at internationally and nationally, there are really good models. And as we look at workforce investment, conversation I've had with Ranking Member Fox for years, sometimes comical from our perspectives, but the importance of incentivizing best practices at workforce investment boards at the state and local level. So we can learn from one another, as Representative Fay has indicated, but not just accepting the status quo. So with that, as we reflect on the critical role that direct care workers play in ensuring that aging Americans and Americans with disabilities can live independently, just want to thank everyone again. And fortunately, the challenge is real. As we discussed, direct care workers are still not being provided the basic tools to make them successful for their clients: fair pay, good working conditions, and continuing training that would allow them to join and stay in this professions and change the really horrible 82% turnover. And that's pre-pandemic. So some of the comments by some of my colleagues, pandemic has clarified and made it worse, but we had a real problem before pandemic. So this chronic lack of investment in direct care workers must change if we are to secure the future of direct care workers and the clients that they serve. To that end, I'm pleased we discussed how the investments in the American Jobs Plan, drawing from the Direct Care Opportunity Act, would strengthen the direct care workforce pipeline. I look forward to drawing from our conversations today and working with all of my colleagues to secure the support that our direct care workers need to provide long-term care for our communities and for our country. Thanks again so much. And if there's no further business, without objection, the joint subcommittees will now stand adjourned. Thanks again so much.